Survival Guide 2012. Thank you guys so much for coming. Coaches, parents, and athletes. Our Survival Guide series is inspired by you guys. We've got 14 physical therapists that make their living taking care of hurt people. And over the course of the last 5 years and longer, I've been practicing 10, we've been seeing the number of young athletes that are just like represented here tonight. We're seeing that number grow. And the cold hard facts are, since 2000, we've seen a 5-fold increase in the injuries to our young athletes. And baseball players are number 1 on that list. It's not football, it's not soccer, it's these young men and young ladies that are playing baseball that are getting hurt more often than their friends who play something else. So it's been our mission at Kinetic Physical Therapy to help educate the public. You know, we kind of feel like it's not necessarily too late. We're glad to see you in our office, but at the same time, we want to be able to give you the tools to keep you out of our office. It's the worst business plan 3 physical therapists could ever think of when they started a business. But it's something we feel strongly about, and we want to be a resource for you guys. And with that said, it's important that we make community relations with people that are better at their job than we would like to be. If I want to help somebody with pitching mechanics, I'm not really the guy. I can pick up some things, but I want to be able to pick up the phone and call Mike Manning from All-Star Baseball Academy. He and Karen have been absolutely fantastic. We walked in these doors probably 6-8 weeks ago, hoping we could hold our seminar here. They welcomed us with open arms, and we are absolutely honored to be in this facility and in the presence of who we feel are the best people to train your young athletes to play this game. So thank you so much to Karen and Mike Manning. Along with that, thank you to Dan Blake, the manager here. He's been absolutely fantastic and forthcoming and welcomed us with open arms. He's watched me camp out here for the last couple Thursdays, offering some free screens. So thank you guys so very much for creating this community relationship. Thank you to our community professionals. Ladies and gentlemen, you've got some of the best minds in this community here tonight and ready to answer any question. If they didn't answer it, you're going to have a panel discussion later that you'll have the opportunity to ask any question you want of these professionals, and the list I will get to in just a moment. I've already alluded to our purpose tonight. I want you guys to check out Mike Manning, as I've stated, is going to talk about the hierarchy of good pitching mechanics. He's going to talk about some red flags. We are so happy to have Jesse Biddle, #1 draft pick of the Philadelphia Phillies a couple years ago, big left-handed pitcher who's going to be part of our panel discussion. You're going to be able to talk to him about what it took for him to get where he's at, and also what it takes for him to stay where he's at. And then we're always honored to have our good friend Scott Sheridan. I've had the pleasure of knowing him for the better part of 14 years. He has had an opportunity to work with Dr. Eric Zabat for the last 5 years that we've been in business. I can't do my job without Dr. Zabat. He comes with a wealth of sports medicine experience. He had the opportunity to do his sports medicine fellowship with the Cincinnati Reds. This guy is an unbelievable resource for anybody who picks up something and throws them, whether it's a baseball player or just an overeager weekend warrior. But Dr. Eric Zabat from Pennsylvania Orthopedics.
All right, everybody. Thank you, All-Star Baseball Academy, for inviting us here. Kinetic Physical Therapy. I got to pay Chris a little bit for that introduction. It was a really nice introduction. I've been with my group locally now for about close to 5 years now. I'm going to show you what I see in the office and what I see from an x-ray standpoint, what I see from a physical exam standpoint. I want to discuss just briefly the role of the sports medicine team. I'm going to scratch the surface because I know these other guys are going to do a fantastic job of what they see and how they're going to get you back on the field. And we're going to see how we can go ahead and keep you out there, okay? So, common questions, which we're going to continue to answer. Yep, coaches, parents, everybody asks me, Doc, how many pitches is my pitcher allowed to throw? Can our pitcher's mechanics really prevent injury? And at what age should my pitcher be throwing the curveball? Well, what made my job even more fun this past year is Little League Baseball, and UNC did this past summer of 2011 said the curveball does not cause injuries. So basically, controversy with 60 years of medical research just got changed, put up on its head, and basically the answer is no one really knows. So let's give you a background. 4.8 million kids out there age 5 to 14 are playing softball and baseball. Half of these kids are getting injured strictly to overuse. I mean, they're overdoing it. Half of these kids are overdoing it with all aspects of sports. We're trying to prevent that. The American Medical Sports Institute, that's what AMSI alluded to, is five-fold increase in serious elbow injuries for the last 10 years of their data, okay? Throwing a baseball on the mound is an unnatural movement. These excessive forces can cause problems in your elbow and your shoulder. So briefly, shoulder anatomy. Pointer is here. So right into here, we're going to show you, this is the clavicle, collarbone. This is your humeral head. And right here in a kid who's growing, we're going to, on future slides, I'm going to show you where that can get injured. Over here is basic rotator cuff muscles. I just showed you the front of the muscles, the subscap, the supraspinatus is up into here, infraspinatus back here, teres minor. This is only a few, but I want to stress the whole body is important with throwing a baseball. The future slide I was mentioning to you was what I wanted to stress, and right into here, if you could see, this is a scapula, your collarbone up in here. Right in here, the youngster, 12, 13, 14 years old, this is a growth plate. Now, what is a growth plate? A growth plate is a location that's soft, that's eventually, over time, as a child goes through puberty, starts to get harder and harder and fuse into the normal structure of an adult male. But during that time, this is a spot that tendons, things pull on and can injure in our growing athlete. As you can see from this side, you see the red happening into here. That's a sore spot that you'll sometimes see in an athlete, and that's what we want to focus on preventing. Mechanics, I mean, go through the whole thing, phases of throwing. I mean, there's so many different phases here. Wind up, cocking, phase, acceleration, deceleration. You got the gathering phase all the way through this whole mechanism. Early cocking, late locking. Pretty much, an athlete can get injured in any aspect of this. We got to work with the guys at All-Star Baseball Academy and the guys at Kinetic Physical Therapy just to make sure we're doing that in the right way. So basically, common shoulder injuries. There's 10 plus injuries out there, but for a baseball athlete, common injuries. Little league shoulder is a broad term. I just use that for the proximal humeral apophysitis, rotator cuff, tendonitis, going into syndrome, going into tear, instability of the shoulder, whether you have these ligaments that try to anchor you in the front and in the back, and ultimately with a rotator cuff injury, instability can ultimately lead to a labral injury, and I'll talk about that on future slides. So let's get started. This is important. This is a common concept with a young shoulder and an elbow. With repetitive throwing, ligaments and tendons put tension on the end of the bone. What I was just showing you, that humeral head is a weak spot. You're pulling on it, you're pulling on it, you're pulling on it, you're throwing. It causes inflammation of that growth plate, and ultimately that'll cause a stress fracture. Things you have to look out for, just a mild soreness, even just a little bit of deltoid soreness, that's something we got to be concerned about. Yes, a little bit after the game, but the ongoing days, that's something we got to be worried about. Activity-related pain, tendon to touch. As coaches and parents, you got to look at the effectiveness and velocity of how your athlete is throwing that ball. So, little league shoulder, localized to that proximal humerus, and I can see the picture right here. This is the growth plate we're pointing at right into here. Usually it happens in age, starting at the age of 14. It can happen in either younger or older, plus or minus a couple of years. Symptoms can go on for about 8 months. History, it kind of hurts me a little bit sometimes. Proximal arm and shoulder pain. Physical exam, I'll just sometimes ask it and just put my finger right there and compare it to the other side. And I'll say, kid, does that hurt? Yes, it hurts. That's a red flag to me. Rotator cuff weakness, I'll test the rotator cuff, all the testing, and it'll be weak on all ranges of motion. Sometimes on x-ray, we'll see a widening of the growth plate, sometimes we won't. But just by me putting my finger there is some alarming sign for me. Continuing on with rotator cuff evaluation and general injuries, you gotta look at that injury. Was it a specific injury? Most of it's kind of a gradual thing. Gradually over time, you kind of feel like you got a soreness in your shoulder. Sometimes impingement can occur during the cocking phase, bringing your arm back. Sometimes during the acceleration, we'll have more of a commentary, but that's not always the case. Just to kind of give you some guidelines. Physical exam, we'll test active and passive range of motion. We'll do some apprehension relocation tests where we're going to go ahead and see if this feels loose or tight when you examine you over in my office over at Kinetic Physical Therapy. Decrease in strength, we'll often see, but we'll rarely see a full thickness tear in this age group. Rotator cuff injuries, first thing you want to definitely do is rest. How long? It varies per athlete. You want to ice down that athlete, you want to give some anti-inflammatories. When they're pretty much close to being pain-free, you want to go ahead, restoring range of motion, strengthen the cuff, the scapular stabilizers, core, and more core. And then eventually you want to work with a throwing program with the Kinetic and All-Star Academy to get you back out there. Ultimately, if we're not getting much success with this, on a rare occasion, sometimes you'll need surgery. This is just a typical sleeper stretch you see in the picture. Shoulder impingement syndrome sometimes happens in a later age group. I sometimes see this in more of our high school athletes, Division I athletes. Sometimes happens through the cocking phase of the throwing motion. Can lead to chronic inflammation. Often things you'll hear is, Doc, I feel like something's rubbing together and it's really way too painful to raise up my arm. Sometimes shoulder impingement can occur how you were built. From an x-ray standpoint, some of us have a very flat one bone called the acromion. Some of us will have a very curved bone or almost a hook to that. When you raise your arm up, you're more prone to impinge or get that rotator cuff caught. That's what we call with impingement. Another aspect we see is often instability of the shoulder. We'll say, Doc, it feels like my shoulder's coming out of socket. I feel like I have this crunching sound. Every time I lift my arm, I feel like it's going to slip out of joint. You'll have a clicking or a catching or a sensation of a dead arm. It can happen something traumatic, such as a traumatic throw, but oftentimes it's more repetitive use. Sometimes congenital. Hey, my mom and dad, they could do this trick. I could do this trick too with my shoulder. And rarely you'll have that sensation of I completely can pop it out, but it can occur. So basically instability, you want that period of rest, ice, working with a physical therapist, and they'll show you some exercises here at Kinetic. And sometimes on a rare occasion, surgical stabilization is necessary on a rare occasion. Ultimately, the setup for this, rotator cuff injuries, instability, sometimes they'll be prolonged pain, sometimes eventually you might have this labrum tear. So what is a labrum tear? When I use the example of talking about a labrum tear, I try to use the example of a golf ball on a tee. Your humeral shoulder is here, your base is your acromion here, okay? That labrum is almost like that suction cup. So you're sitting there and you're running it and you're throwing the ball. You're running it and it's moving in all different places. You could cause a tear in that suction cup, and that's what that labrum is. Another example I use is like an inner tube of the tire. You're constantly running that across, and that little tiny tear can progress and progress and progress, and that's when we have some problems or issues going on here. It's a disruption of that biceps anchor right across here, if you guys can see that pretty well. And eventually that can completely come all the way across this region and completely be torn. It can occur alone or with instability of the rotator cuff. Now sometimes this is tough to see on a basic MRI. So sometimes what we'll go ahead and do is inject some fluid in there and basically look for a leak. As you can see from these images here, you can see all this white stuff here, guys? See that? Naturally, you shouldn't see all that white stuff so much down into here. If you see that one spot, this athlete here has a labrum tear right across that one top part, that little suction cup has been completely torn, okay? Pain in the front of the shoulder. Sometimes when you're going through the back, posteriorly, you'll get that pain right across that back region, okay? It can happen in acceleration, but it can pretty much happen in any phase. Loss of velocity in any phases. In physical exam, we'll do some specific testing, such as the Bryan test, and like I mentioned to you, dye, injectors, looking for those leaks is indicative of that labrum tear. Initially, we want you to go ahead and rest, physical therapy, but oftentimes more than not, these tears do progress, and sometimes these tears need to be surgically treated and repaired. So, in general, looking at little league shoulder, our goals are rest until your symptoms are pretty much pain-free. We want that team effort, whole medical team involved. Sports medicine doc, guys here at Kinetic Physical Therapy, All-Star Baseball Academy, a trainer, coach, the parent. We all have to know how do we get our athletes safely back out there. We want a specialized rotator cuff and throwing rehab. You want to get that athlete back there gradually but in a safe way. So let's do an example here. I always, with our survival guys, I use examples. So this is a little Chris Shearer, you know.
Southpaw.
Yeah, he's a pitcher, he's a catcher. He's been having pain, I don't know, maybe on and off for about 8 months or so, but it just got worse. But, you know, it got worse when he decided to go do his Little League team and the travel team. So he comes in my office and says, Doc, it hurts me right here. And I say, okay, bud, let's get a set of x-rays. So you look at these x-rays, you're like, oh, this is not too bad. Well, how do I go backwards in this one? Go back another one. All right, good. So I'm looking at him, I'm like, there's that growth plate right here on little Chris, and there's it right into here. Well, I don't know, that looks a little bit wide, but I'm not really 100% sure. That looks kind of a bit wide to me. Let me compare with the other side. I'll compare the other side. Now can you guys see the difference? You see this side, how that growth plate right into here is nice and more close there? Can everybody see that? Now can you see on this side how it looks more widened? All right, so that's an athlete with that epiphyseal injury, that physes injury, that growth plate injury we're trying to avoid. So a little break in the action here. All right, so let's move on to talking about the elbow, the Little League elbows, okay? It's a catch-all phrase for elbow pain in young throwing athletes. It comes in a lot of different flavors, but I'll talk to you about, you know, the top 4 that we usually see in an office setting. So basically, a little breakdown of elbow anatomy. This is an adult, and an adult, you got that medial epicondyle. This is where that ulnar collateral ligament attaches. You got your capitellum, you got your humerus, you got your 2 forearm bones. On this right side is the growth plates. This blue stuff right here, and another one here and here you can't see. That's bone that's trying to fuse, you know, 12, 13, 14-year-old, trying to fuse across that whole entire region, okay? I showed you the bones, and I'll show you, you know, more of the ligaments. So the ulnar collateral ligaments here, this is with the medial epicondyle. He's got, or kids have a growth plate right into here. Then you have the wrist extensions that lie at the top here, and the wrist flexors that lie more at the inside aspect of the elbow. Sometimes you'll see athletes with starting to have pain in that flexor area. That's a little red flag we've got to be aware of too, when our athletes start to have that forearm pain. Continuing on, the important bundle here that we worry about is the ulnar collateral ligament bundle. Right here, the anterior bundle, posterior bundle. This is on the inside of the elbow. This is what we always worry about. This is where you hear about Tommy John surgery. This is the torn ulnar collateral ligament. So I mentioned before, many phases of throwing motion that we see. Somewhere in the red, you'll see those issues where we have a lot of our patients have pain. You got to think about it when you throw a ball. This is a right arm, but you're looking at you're putting stress on this inside aspect of the arm where your ulnar collateral ligament is, and you're putting compaction stress on that lateral side of that whole region, okay? So it's medial elbow traction, lateral elbow compression. These forces can cause a whole lot of problems with that stress in a throwing arm. Similar as the shoulder, repetitive throwing ligaments and tendons put tension on the end of the bone, causing inflammation and ultimately stress fractures. Same kind of concept with things to worry about. Active related pain, tenderness to touch, decreased effectiveness and velocity of throwing. As you see from these pictures that I just shown you, that bone is trying to fuse. When you're throwing a ball, you're constantly pulling in that bone, and eventually that can be an issue for you. The other side is compression when you throw a ball, and that compression, these two bones are constantly butting heads. So things to look out for, some basic things here. The big term right here, you know, osteochondritis dissecans of the capitellum. Otherwise, terms use that as OCD. How do I go back again? So we're going to that. And then medial epicondyle apophysitis, which is inflammation of the growth plate, which is up into here. Eventually, if you keep pulling on that growth plate, it'll end up being a fracture. And sometimes it'll be an ulnar collateral ligament injury. Clinical features you'll see in a thrower. That insidious onset, decreased performance, loss of motion in the throwing athlete, tenderness at that medial, lateral, posterior elbow. It can hurt any place, sometimes, especially like I mentioned before, over that forearm. So let's start off with talking a little bit about OCD. Happens rarely, but it does happen. It's pretty much cell death of that one bone region, okay? Repetitive trauma, overuse, less blood supply to that inside bone called the capitellum. It happens in throwers, ages 11 to 16. Elbow stiffness, pain, catching, locking sensation happening. Now looking at this, I want you to focus on the right side first. On the right side, right in here, this is that capitellum, that's that one forearm bone. Those two bones will constantly butt heads when you throw a ball. So I'll look at that comparison and I'll look at the right side. Can you see how it's just a little bit darker over here, guys? That's the bone, that's a divot started created by throwing a ball too much. Okay, so you create a little divot in the bone, okay? Another images of that, this is a bit more obvious. Can you see that darkness right in there, guys? See that there? And then this is a CT scan showing how that repetitive trauma, that bone over that causes that bone to say, hey, guess what? I'm going to create this divot and I'm going to be eventually breaking off. So, continue talking about ulnar collateral ligament injuries, and I'll break by giving you another quick little story, as quick as I can make it. So during my training, I had the opportunity to work with my mentor, and we had the opportunity to see Little League athletes up to Major League Baseball players. And sometimes during my fellowship, it was crazy. We'd see up to 80 to 100 athletes per day. Sometimes half of these athletes are having arm injuries because they were looking for seeing my mentor. And his name is Dr. Kremchek. And if you ever met Dr. Kremchek, he's kind of a character. So we'd have this whole pod, and I'd be pretty much running around the whole entire pod. My job as a fellow is what I would do a history and a workup on the patient. Dr. Kremchek would come in and he'd close on the patient. So I remember him, he had a loud voice, kind of a very large room. So I'd be on the other side trying to work up, try to get through there. He'd yell and be like, Zabat! Zabat! If he yelled for me, I'd come running. He's like, what's going on, room 5? And I'd say, all right, this 16-year-old male, ongoing pain in the medial aspect of his elbow. This past 3 weeks ago, started to do his 2 travel teams, felt a pop in his elbow. He's like, all right, and just kind of like shaking his head. And the next thing he would be like saying to me is like, when do you start throwing a breaking ball? I said, Doc started throwing the breaking ball when he was 12. So, I know there's all this data out there. I know all this research that says, hey, you're allowed to go ahead and do it. But out there, I'm telling you more often than not, we're coming across with kids, 10, 11, 12 years old, who are getting injured. And sometimes, like I said, I mentioned a 16-year-old. Well, he was throwing the breaking ball at 12. Those are 4 years of micro trauma. Soreness, my elbow's sore, I'm gonna keep throwing. I'm not throwing right, I'm not learning it right. All those 4 years, and eventually, 16 years of age, tore his ulnar collateral ligament, and he's done. So we gotta prevent this from happening to a lot of our athletes, okay? That year during my fellowship, I think Dr. Kremchek did about 150 Tommy John surgeries, and he wasn't doing all Major League Baseball players. So, continuing on, the first thing you'll see, what I'll see in some of my athletes in my setting is that medial elbow pain, that little sensitivity. So, manage it acutely. We've got to control the pain, rest, ice, compression, brief medication. Long term, we want to work on non-painful range of motion, ground return activities, easy throwing, pitching mechanics with professionals such as the guys here at All-Star, working with the guys at Kinetic, get you in a good throwing program, eventually trying to throw. So another little example here. So I got, I don't know, I got little Chris here again. He's been having nine months of pain happening. Decided to join that travel team. Have not seen a doctor yet, but possibly with this elbow pain going on for 9 months, his elbow kind of looks like that. They're in the playoffs. 2 other pitchers are down. Coach says, hey, can you throw about a little bit more, 15 extra pitches? I don't know, you throw some breaking balls in there. So what happens, he does it. feels this more and more soreness and actually pain, comes and sees me, what happens? That whole elbow, that whole bone is torn off. You see how wide that is, guys? Right here and into here. So we really have to be careful about what we do. We all know pitch counts, and I'm just going to, brief on this and just kind of show, because we all know we can find it. Stop Sports Injuries has it. USA Baseball has it. Look Baseball. Pitch count is very important with regard to things. When I stress that in this next slide, from this standpoint, my feeling is how we treat our professional athletes in terms of the warm-up, the stretching, the taking the time, and listening to the soreness. We should definitely be treating, our younger athletes that way. I mean, be just as careful. Unfortunately, we don't have the luxury of getting to the ballpark at 2 o'clock for a 7 o'clock night game. All right, we're running over, we're picking up our kids, we're bringing them over right to the game. They have a quick little 10-minute warm-up, and then they're pitching. We've got to find that nice happy balance with going ahead and seeing what we can go ahead and do. So pretty much pitch type should be limited to reduce injury before age 10, only the fastball. After age 10, changeup is permitted. Other pitches, which I think the other team members of our talk will talk about. I think Scott Sheridan is going to talk about that. Recommendations, breaking pitches should not be thrown, for my recommendation, until bones have matured, indicated by puberty. Pitchers should be prohibited from returning to mound once they've been removed. We won't want multiple teams. We want age-appropriate pitch limit per game. We want to encourage at least 3 months away from baseball. I mean, you see all our professional athletes, their pitchers are taking a nice relief from throwing. Actually, there was data on this done that those pitchers who threw more than 8 months out of the year were 5 times more likely to injure their elbow. So think about that. I mean, we're saying 3, we're talking about just 8 months, okay, more than that is what happens. Maybe not too much an issue in the Northeast, but across the country, this is a big, big issue. And I want to also continue on by saying something that James Andrews did quote, quoting directly from him is, my thought on it is you shouldn't throw a curveball until you can shave. So the answer, from my standpoint, educate, prevent, pitch count guidelines, don't use the radar gun, don't play year-round, control accuracy is what we're working on. Then you'll eventually be able to throw those different pitches, work on core, and just don't throw on a tired arm. I want to close by saying, go Phillies. All right, so we have any questions? All right, thank you guys.
Yes, and remember, we will do a panel discussion, so we can, if you hang on to questions, definitely keep them fresh in your head, because we will absolutely address all of them. All right, moving right along. If you saw me on the 10 show not long ago, you heard me talking to Bill Henley and trying to explain that pitching is an explosion, and you can't effectively generate force to that little white baseball if in the middle somewhere is an improperly prepared core. This is definitely a buzzword in physical therapy and fitness. What is the core? Well, these two gentlemen are going to let you know what that is, and they're going to show you some things that you can do to train your core more appropriately for throwing a baseball. So it is my pleasure to introduce two guys that I work very closely with day in and day out, Drs. Darren Rodia and Drs. Matt Schildneck from Kinetic Physical Therapy.
Testing. Man, Dr. Zabad started the great curveball debate early, huh? Right after it. How should we talk? I want referrals. I can't. I have to say yes. I agree. Great, Dr. Zabad. Okay, thank you all for coming. The pitcher survival. I'm gonna drive Brian crazy here. Some of you walking around. The pitcher survival guide is something that we feel very strongly about. So we certainly appreciate you all coming here and giving us your Saturday night, and so hopefully we make it worth it for you. Every year we try to add something new. I see some of you in the room have been here last year, and a lot of you new, and we try to add something new every year. Okay, something that is current, is hot, is based on the current research and things like that, and things we can give you right away to take with you. That's what we're hoping to do. Certainly, I'm not going to stand up here in any way, shape, or form and make you go from a 75-mile-an-hour fastball to a 90-mile-an-hour fastball. Certainly, we're not going to say that. But one of the things I'm hoping I can do is give you the importance of the core in maximizing who you are. and maximizing your own athletic performance. If you're an individual who has the capability to throw 93 miles an hour, maybe you're only throwing 85 miles an hour because you're not training your core properly. We talk to coaches, Chris, Ange, and myself, we talk to coaches for a living, we talk to parents for a living, we talk to baseball players for a living, and invariably we hear that there's not enough time in a practice session to address the core. I appreciate that. We get it. There's a lot of things to do. You got to catch the ball, you got to hit the ball, you got to throw the ball. I get it. There's a lot of time you have to spend on the glove, catching pop-ups, and so on. But what I'm hoping I can do today is slowly paint a picture that allows you to understand how important this is, how to look for it on a general basis, and then hopefully we can give you resources to be able to call us or call people here at All-Star Baseball Academy, Dr. Art Sabat, and really say, hey, you know, I think there's a core problem here, and we'll go from there. The outline for discussion today, my name is Dr. Darren Rodea. I'm one of the 3 principal owners of Kinetic Physical Therapy. I'll be doing this presentation with Dr. Matt Chilnick, and no, it's not good. I told him, don't click until I point. That was a wave, not a point. So we're off to a bad start. We're off to a bad start. Okay, we're going to talk about what is the core. We're going to try to define this, okay? It's not the infomercial thing that you see on TV where people are doing sit-ups and things like that. I assure you it is not, okay? And then what is core stability? Okay, we know what the core is. What makes it stable? Does a sit-up make it stable? Does a plank make it stable? What does it mean for it to be stable? And more importantly, what does it mean for it to be stable for you pitchers out there? What does that mean? Okay, how does the core work? I think that's very important in us painting the picture here, in which is getting you to see the importance of this and then how to work on it. So how does the core work? I'm going to give 3 very basic research studies, very good research, but just basic. I'm not going to go over things like statistics or ANOVAs or anything like that, but basic research to support how core stability relates to pitching performance. Great research, okay? And then Dr. Matt Chilnick is going to come on, and then we're going to start to give you how do we assess the core. Just 2 or 3 things you can take with you today, use tomorrow, and then just a couple things, how do we go ahead and improve that core stability. And again, this is not meant, as Chris said earlier, it is not meant to take you away and have you have an athletic training license or a PT license, no. But it's hopefully you could see certain things going on, consult your professionals, maybe even fixing yourself in the confines of your own pitching practices and so on. Okay, I'm going to start the discussion with a quote from Dr. Ben Kibler, W. Ben Kibler. The core musculature includes the muscles of the trunk and pelvis that are responsible for the maintenance of stability of the spine and pelvis and help in the generation and transfer of energy from large to small body parts. Any pitching coach out there in the room, any father or mother out there in the room who's training your pitcher knows that you don't pitch with your arm, you pitch with your legs through your body. Okay, at the end of the day, if you think the small body part is your hand, this is where the force has to ultimately get to. That's got to come through your legs. Okay, the core is in the middle of that, right? If you're driving off the core, it's in the middle of that. Okay, next please. Okay, brief anatomy, brief. Okay, the core is numerous muscles, bones, and connective tissue structures, some large, some small. Okay, I'm just going to give you, this is in no way, shape, or form a total list. Okay, but just some basics, and it helps illustrate a point I had in the very next slide. Okay. First one is your rectus abdominis, which is your, when you have washboard abs, that's the stomach, that's the muscle you see. Okay, the next one is the transverse abdominis. This is the muscle you don't see. It's very integral in inter-abdominal pressure and stability all the way around from 360 all the way to the front down to your back to your spine. The obliques are the muscles on the sides. Okay, the multifidus and other paravertebrals are muscles that are on the spine proper. And whenever, I spent a lot of time in the gym growing up, and everybody says, okay, what body part are you lifting today? I'm lifting the back. Well, whenever they lift the back, not really lifting the back, they're lifting the shoulders, just the back of it, the lats. The multifidus is a muscle that's actually on your spine, okay? Very important, you can't really get it through the shoulder, it's sort of on your spine. Here's where it gets interesting, the diaphragm. Okay, the diaphragm is a breathing muscle. Very, very important to core stability. Breathing is very, very important in what you're doing. The diaphragm is where your lungs and heart sit. Okay? The pelvic floor is where your abdominal organs sit. Okay? Your hip flexors are the muscles in front of your, right here on your leg. Okay? And they're pretty long. They're short at this point, but long, and they go up through the spine. And then your gluteal muscles, not just your gluteus maximus or the muscle that you're sitting on now, but the gluteal muscles, which in essence go around your hip. The whole group is very important. Here's the point. Structurally and functionally, the core should be thought of as a cube, not a board, as a cube, not a board. Which means six-pack abs have nothing to do with functional core strength or stability. Nothing. It just means you have a lack of body fat in that area. That's all it means. That's all it means. It doesn't have anything to do with how functional you are. Also, good breathing technique is important. Okay? If you're holding your breath through the motions, any hitting coach out there will tell you, any pitching coach, if you're holding your breath through the motion, you're losing your power. Why is that? Because of your diaphragm, right? Your diaphragm's on top, your pelvic floor is on the bottom, and the other muscles I talked about make the other walls, and in essence make up the box. Very, very important to understand. Okay, let's start to define core stability and start to continue to paint this picture. Core stability is when your core functions to allow your extremities, including your hands and feet, to achieve maximum athletic performance. Maximum athletic performance. This includes not only power, speed, and endurance, but fine motor control and dexterity. Let's talk about this slide for a second. Certainly as a physical therapist, I'm going to stand up here and talk to you about injury prevention. Dr. Eric Zabat certainly going to talk to you about injury prevention. But this is the important thing to remember about putting good core work into your practices, in your baseball practices, is this. You can maximize your athletic performance. Not only will you prevent injury, but you can maximize your athletic performance. Let's speak to the point I talked about earlier. Maybe genetically, you're somebody who has the ability, has all the potential in the world to throw 91, 92 miles an hour. Okay? But you're only throwing 85 miles an hour. The difference very well could be how you train the core and other parts of your body. Are you maximizing who you could be? I am no way, shape, or form implying that you could do core work, and if you're somebody who can only throw 75, now you can throw 95. Of course not. That's work ethic, that's patience, that's training, that's your parents, that's your coaches, that's also our baseball academy, and so on. But what I'm telling you is if you're doing all those other things right, you have a chance to maximize your athletic performance by maximizing who you could be physically, and that's the key here. So we're not only talking about injury prevention, but we're talking about maximum athletic performance. Okay, fine motor control and dexterity. Okay, I'm talk to you a little bit about throwing pitches later in the presentation, but in order to get your fingers on a two-seam fastball, in order to have this level of dexterity here, and you don't want to grip too hard, you want to grip just right, you really need to stabilize your core. Okay? Greg Maddux once said that he won't go out for his pregame warm-ups until he hits the mound 10 times with his foot in the spot that he wants to hit it. 10 times. Has nothing to do with his legs, I assure you. That has to do with his core balance, his functional core balance that allows him to hit his foot in the mound every time to be able to get to control. And as you know, Greg Maddux is a guy with great control. Next. Okay, athletes should be their strongest and most stable when in the position of specific function. Athletes are be their strongest and most stable when in the position of their specific function. Strength and stability comes from the core. Perfect example, hockey player set. Hitting a one-timer, slap shot. You're down here like this. This is where you need to be strong. Quarterback, when you're throwing, you need to be strong and stable and balanced in those positions. Okay? That can go soccer, you know, when you're going to kick, strong and balanced. Let's take this young man right here. Okay? He needs to be very strong and very stable in this position. He's about to go into acceleration. In other words, all his body parts are going to start moving toward the plate, right? So he's about to go into acceleration. He's about to go into early cocking. Okay? In this position right here, he needs to be very strong. You should be able to throw a ball at him and it would bounce right off. To give you an illustration, try to imagine, say this young man here throws 85 miles an hour. Try to imagine him doing that same thing on ice. Instead of a pitcher's mound, try to imagine him standing on ice. Is he going to generate 85 miles an hour? No. No, he's certainly not. The core should be thought of as that. If you're unstable through that region, you're in essence throwing off ice. You're not maximizing your platform. You're not getting a stable base, and it's going to affect performance. Okay, the core acts as an anatomical base of motion for the distal segments. It can be considered proximal stability for distal mobility, and I added precision for distal mobility. Another quote from Dr. Kibler. Let's talk about that pitch. Let's talk about distal precision. Okay, for purposes here, proximal means the middle of your body. Okay, toward the middle of your body. Distal means furthest away. Right? Distal is furthest away. Well, you need proximal stability. In other words, the middle of your body needs to be stable to get that distal precision. Okay, why do we need distal precision? When you have a release point, when you're a pitcher, you have a release point, right? That release point needs to be the same place every time. okay? If you're off balance, you're just going to grip too hard. Now, it may not be so hard that you don't get the pitch off, but it may be hard enough that you try to throw the outside corner and it goes off the plate. It may be hard enough that you're trying to throw on the inside corner and it goes over the plate. Just enough, okay? Also, your fingers, if you're doing a two-seam, if you're doing a four-seam, if you're doing a slider, okay, that you need precision at your fingertips, okay? Without the proximal stability, without good core stability, functional core stability, I'm not talking sit-ups, functional core stability, you're not going to get that distal mobility and precision that's going to allow you to excel. Pitchers with good core stability are able to achieve maximal arm speed while still maintaining enough dexterity in their hand to achieve the appropriate grip to throw the desired pitch. In summation, core equals better velocity, control, and endurance. This is what I want to hammer home by this slide, velocity, control, and endurance. Okay, maybe you're somebody at the Division I level, and you're a long relief person, because that's just who you are. You were told that that's the talent you have. You're a 3 to 4 inning individual, that's all you got, right? Maybe you're not, though. The reason you're thought of as a 3 to 4 inning person is because 5 and 6 innings, at the 5 and 6 inning mark, you start to lose your control. You start to lose your velocity. Okay, some people are just long relievers. They're not meant to be starters. Okay, but maybe not. Maybe you're not maximizing your core. Maybe your core is starting to fatigue after the 3rd or 4th inning, and you're not getting to the 6th inning because you're starting to fatigue, and it starts to affect your performance. It could be just that. Okay, and that's really an important concept to remember, is that, sure, I'm not going to sit up here and tell you I'm going to take you from somebody who doesn't pitch and make you a 9-inning person. But what I'm going to tell you is, maybe if you do have good core stability, you can maximize who you are, and maybe you're not a high school pitcher who stops there. Maybe you're instead of being a 4-inning high school pitcher, you're a 6-inning Division I. Maybe instead of being a 6-inning Division I, you do good core work, you learn about this, you take it seriously, maybe now you're a AA player, and so on. Okay, one slide on how the core works. Okay, the core works in something called a reflex arc. Okay, you train it so it just reacts effectively. A couple illustrations of this that we see all the time. One is walking, right? You don't think about walking, you just go. Okay, it goes from your head into your spinal cord, into something called a central pattern generator. It just goes into your spinal cord. Okay, because you do it all the time, it just becomes a reflex arc. Okay, a running back with Sean McCoy for you Eagles fans. He's going into a hole. He makes a move left or right. He doesn't think about that. It happens too fast for him to actually think about it. He cuts left, cuts right, and he just reacts. That's the way your core works. If you're a hitter, right? If you're Ryan Howard, you're trying to hit one over the fence. He can't think about, okay, I'm going to drive my hips through the ball here. He thinks about, okay, pitch is coming over the plate, and boom, there it goes. He couldn't possibly think that fast. The core just reacts, which means you can do all the sit-ups in the world if you want to be good at sit-ups. That's all it's going to do for you. Okay? You can do all the planks in the world, but you can be good at planks, and that's it. You need to do functional work, real-time, real-position stuff that really works for your specific sport. In this case, we're talking pitching. Sit-ups will not work. You need to train the movement, not the muscle. Okay, I'm going to talk to you about 3 research studies here. We're not going to bore you with statistics or anything like that, but I want to really see if I can bring the conclusions home here. Okay, the first one is one by Dr. Chahari. Okay, lumbo-pelvic control and pitching performance in professional baseball pitchers. This was done at Ohio State University. Okay, what they did here is use something called the level belt. Okay, they took 75 athletes and they put a level belt on them, and then with this level belt that was monitored by sensors, they had them do various stability exercises, from 2 legs to 1 leg, back to 2 legs, and so on. And ultimately, what they found is pitchers who are able to throw the fastest develop the largest ground reaction forces, transferring energy from the lower extremity to the hand through the core. They did this because they took the level belt work and they compared it to innings pitched, strikes thrown, walks, and so on. And they were able to ascertain this conclusion here. Pitchers who were able to throw the fastest developed the largest ground reaction forces, transferring energy through the core. Same study, further conclusions. Poor lumbo-pelvic control. Statistically, according to this study, poor lumbo-pelvic control was associated with poor ball control and velocity. Okay, they found it statistically. Pitchers may then overexert their arm muscles to compensate, which will lead to lower pitch counts and high risk of injury. Here I go talking about injury, the injury prevention piece now. Okay, Steven Strasburg, right, for the National. He tore his UCL right here, or he thinks he did. I mean, ultimately he did. But this is a guy who will throw 98, 99, 100 miles an hour. Okay, I don't know Strasburg, I wasn't on the field. I don't know if this is why he hurt himself. but somebody at those velocities, just like Chapman, this may very well be a plausible explanation. Because what happens is, maybe he gets tired. This is a young man, big kid, but young. Maybe he gets tired at the 6th inning, but he still needs that velocity, so where does he find it? Maybe he overexerts his arm muscles to do it, okay? The UCL, as some of my colleagues will talk about, the thought that you could actually, you know, I know there's some talk out there, if I have a Tommy John surgery, I could throw faster. That's really absurd when you think of it that way, okay? This all comes from the middle of your body driving through your legs, but what the UCL will do oftentimes is act as some sort of a fulcrum, for lack of a better analogy, okay, when you're throwing up here, especially if you're trying to use your arm. So what this study showed, or implied, is that you may, if you're weak through here, try to overthrow. Now you're leading to all the things Dr. Eric Sabat talked about, possibly. Okay, another study done by Oliver and Keeley out of the University of Arkansas. Gluteal muscle group activation and its relationship with pelvis and torso kinematics in high school baseball pitchers. Okay, this one was interesting. They used like a motion they used some motion capture technology with something called an EMG. Okay, which lets you know when muscles are contracting and to some extent the force of it. Some of the things they found, the segment initiates its movement when the adjacent proximal segment reaches its maximal angular velocity. In summation, it needs to generate force from the inside out. So think about that for a second. From the inside out, that's where you're getting your force. Okay, what they found with the EMG work that they did, which is again, it assesses muscle contraction, the greatest activation of the gluteus maximus was on the drive leg in the arm cocking and acceleration phases. For your right-handed throwers, this is your drive leg. So what they showed statistically in the study is that your gluteus maximus, one of those essential core muscles that I pointed out several slides ago, really contracts in that position. So think about this, guys. Your gluteal muscle group here, core group, is firing like crazy when you're trying to generate your power. Not your arm, right? Not your shoulder. You can build your shoulder all you want. You can build your legs all you want. You know, you can have the biggest, strongest legs in the world. If you can't transfer that force up through your glutes and other core muscles, you're not generating force to your hand. You don't maximize who you can be. Last study. Another one by Oliver and Keeley from the University of Arkansas. Pelvic and torso kinematics, relationship to shoulder kinematics, and high school baseball pitchers. This was another interesting one. They used a different type of motion capture technology that they got from this Rehabilitation Institute of Chicago. And what they did is it's almost, motion capture is the kind of thing that they do in the movies, almost like the Polar Express, if you've ever seen it, where they were able to make Tom Hanks look like he was a cartoon. Well, they did that through the torso all the way up to the hand. Really interesting study. And what they found was the trunk contributes as much as 50% of the kinetic energy and force production during the entire throwing motion. 50%, guys, think about that, 50%. So if your trunk is not functioning optimally, you lose the potential, maybe you're only 80% of who you could be, and that's important. Failure of the kinetic chain could be potentially a detriment to performance as well as exacerbate the propensity for injury. And again, as a physical therapist, certainly I'm going to tell you that, but think about all the things that could go wrong. If you're trying to find that 50% from somewhere, okay, if you're trying to get that force from somewhere, that's coming to the shoulders, that's coming to poor pitching mechanics. That could be a whole lot of things that could go wrong from that. Same study, control of the torso is strongly related to positioning or arm slot. We found in the study. Control is strongly related to positioning, arm slot, okay? We all have a natural arm slot to some extent. I played Little League Baseball for a lot of years. I was a third baseman and a pitcher. And, you know, I was a three-quarter guy. Some people are overhead, sidewinders, and now, you know, you see submariners coming now. And that might be your natural arm slot. That's where your parents put you at some point. That's where your coaches put you at some point, and that's fine. But the thing to remember is your arm slot needs to be consistent. In order for you to be accurate, it needs to be consistent. Let me give you some detail, okay? If you're at the high school level, right, you have a three-quarter arm slot. You might be able to sidewind that and sneak a curveball past somebody. Try that at double A level, you got no chance. Okay, if you can't disguise your pitches, if you can't do like Cole does, which is Cole Hamilton, just throw a 91-mile-an-hour fastball and a 76-mile-an-hour changeup and have it look the exact same way, your ball's going over the fence, okay, and you're not going to make it, okay? Also, control, okay? Your arm slot needs to be in the same place every time if you want to be somebody who hits that outside corner every time. If you want to be somebody whose breaking ball drops out of the zone and not drops over the zone, that changes everything. That could be the difference between who you become. You know, if you're an individual who wants to have baseball as a career, as a living, maybe if you do some of this stuff, you maximize who you are. And that's what I want the lecture piece of my discussion here to wrap up with, is that two things. One, certainly can help you prevent injury. But the goal of any practice, right, when we're with our children, okay, when we're coaches and we're with other people's kids and so on, the goal of any practice is to make our teams better and to make our athletes better. That's the goal of any practice that we're trying to do, right? I talked to several people from several different youth associations in marketing this thing, and I heard from a lot of people that, well, there's not enough time in practice to put this in. Think about that, guys. This is important, right? If you can put some of this core work in, you're still achieving your goal. Your goal is to make your pitchers better. Your goal is to make your athletes better. Your goal is to make your team better. I showed you here, statistically or otherwise, how important this is. If that's your goal, it's worthy putting in, right? And not only that, if you're your parents at home and you're working in the backyard with your kids, you're working in the field with your children, and you want them to have, they wish to have, and you want them to have a baseball career, this is important to maximizing who they can be. I am not sitting up here and telling you I can make you throw a 90-mile-an-hour pitch if you don't have it in you. But what I'm telling you is, this stuff up here can take you from maybe 88 to 91, which could be the difference in how long you play baseball. Dr. Matt Schoen is going to start off the discussion now on how we look at this, and then maybe some ways we can help it.
We use a variety of objective measures to assess one's core strength. And we also use many different assessment techniques. Now today I'm going to focus on three. I'm going to talk about the trunk stability push-up, and then I'm going to talk about two particular positions. The first is called the static K, and the second is the dynamic K. Now, the K stands for kinetic because these were developed by Darren and myself at Kinetic specifically for the use of assessing core strength in baseball players, and in this case, in pitchers. Now at this time, I'm going to bring up someone. I'm going to bring Bob Becker. He's going to come forward for me. Bob is an exercise physiologist with Kinetic, and he's going to be assisting me today. Bob is a former high school baseball player himself. He is going to help me demonstrate both correct and incorrect techniques when we perform these assessments, okay? So we're going to begin with the first one, which is the trunk stability push-up. All right, now, before Bob begins demonstrating that, let me just say that the trunk stability push-up was originally developed by a man called Gray Cook, himself a physical therapist and an individual who has a tremendous amount of experience and respect in the areas of exercise science and sports-specific conditioning. Okay? Now, with the trunk stability push-up, you have to remember that this is an example of a non-functional static measure. Okay? So this is not necessarily one that's going to translate immediately to better performance on the diamond. However, it's a great place to start for a general assessment. And what it does is it tests one's ability to stabilize the spine in a single plane during a movement in which both the arms and legs are fixed to the ground. And clinically, we call this a closed kinetic chain position. Okay, now, using this technique, Bob begins by putting his hands approximately shoulder width apart on either side of his head, and he pushes up. He extends his elbows, performing a push-up position. Now, Bob's going to demonstrate a couple repetitions of that. And what you're trying to achieve here is basically a smooth, coordinated transition from starting to finishing position, treating the trunk as a single unit. Bob's performing that, and that right there is a good plank push-up. You can see a picture of the end position on the left hand of the slide there. Now, in the face of general core weakness, what you might begin to see as someone tries to perform this is a sagging of the low back and also a rounding of the upper shoulders. Now, this is just a sign that Bob is unable to maintain his trunk as a single unit, okay? Again, the thing with the trunk stability push-up you have to remember is it's just a general assessment. This does not necessarily indict any one single muscle group. What it does tell me, though, is Bob's got a weak core, and it's a good place for us to start. Another nice thing about the plank push-up, as we call it, is it can be modified to make it easier. So Bob can keep his hands shoulder width apart, he can slide them down to chest level, and he can then repeat the repetition. Now, this is easier to perform. So if you have someone who's struggling to perform the original technique, you can move to this one. And the final thing that we like about the trunk stability push-up is, as quickly as it's an assessment tool, it can be turned into an exercise tool. So this is something that you can perform on your own starting tonight to begin to address core weakness. But we do stress, as Darren mentioned earlier, with a trunk stability push-up, this is not something that's necessarily going to immediately improve your performance on the mound. That's where we come into the next two assessments. The first of the two positions, the static K and the dynamic K, is the static K. And this tests one's ability to maintain balance and posture in a functional, static position. Now, it's static because as Bob demonstrates it right here, you can see that he's not moving. He just holds that position, okay? The reason we call it functional is because if you look at the position itself, it mimics the wind-up, the first part of the wind-up phase, okay? You can relax for a second, Bob. Now, there's a few things that we look at with regard to this particular position. When performing a correct static K position, what we want to see is, we want to see Bob maintain first a vertical stance leg. So in this case, because Bob is a righty, we want his right leg to remain straight. Also, we want to see a nice level pelvis, meaning his hips are straight across. He holds his opposite hip flexed to approximately 90 degrees and in a neutral position. His trunk is not rotated, and his arms are in what we call an equal and opposite position. So what Bob is demonstrating and what you see on the left hand of the slide would be a correct static K position. Now we're going to make it tough on Bob. He's going to demonstrate a couple deviations. The first one that you're typically going to look for with regard to the static K is you look at the level of his pelvis. If you see any drop in either side of his pelvis, right off the bat, this suggests some core weakness. Now we can pinpoint this specifically to weak hip abductors. More specifically even, we'll call this a weak gluteus medius muscle. So it's one of the three muscles of the gluteal region, and in this case it's the medius, which is responsible for stabilizing your pelvis. So right off the bat, when Bob assumes that position, we see that. The second thing we look for here is we look at Bob's stance leg. If we see that right knee begin to bow inward or deviate inward, clinically we call this a valgus position of his right knee. Now this is a hallmark sign of weak gluteus maximus musculature. That is another one of the muscles of the glutes, and Darren already alluded to the importance of this. So if I see Bob's knee buckle inward, I already know we got a weak glute max, okay? And as Darren mentioned earlier, during your wind-up phase, okay, and into your cocking and acceleration, the transfer of energy through a strong gluteus maximus muscle is absolutely essential to maintain power and velocity into your throwing motion. So with this simple assessment, just having Bob, once again, Bob, assuming that static K position, I've already picked out two areas that need to be immediately addressed on him. I got to work on his hip abductors or his gluteus medius, and I need to work on his gluteus maximus. Okay, the final technique we use, and the second of the two developed by Darren and myself, is called the dynamic K position. And the dynamic K tests one's ability to maintain balance and posture in a functional dynamic position. Bob, why don't you go ahead and do a couple reps of that. Okay, now the reason we call this dynamic and functional, well, it's obvious why it's dynamic. He's moving. It's functional because this, in some way, shape, and form, replicates a throwing motion, okay? So this dynamic K is a functional and dynamic assessment technique that we love at Kinetic Physical Therapy. Take a break, Bob. Now, what we're going to do is, when you use this as an assessment tool, you use it as a complete repetition. So you're not really going to break it down, but for the ease of showing you some things that you want to look for, we're going to break this movement down into 3 phases. Okay, we'll start with the start position of the dynamic K. Now again, Bob is right-handed, so he's going to elevate his right arm. Once again, he's going to have no rotation in his trunk. His stance leg is going to be held vertical. His hips are level, and his opposite leg is flexed to 90 degrees, his hip, and maintained in a neutral position. So if I'm watching Bob right off the bat here, I'm thinking that is a good starting position for the dynamic K. Take a break, Bob. Okay, now I got to give him breaks because, to be honest with you, Bob doesn't have the strongest core. Okay, some of the things we're going to look for. Sorry, Bob. Some of the things we're going to look for right off the bat, some deviations. And you're going to see there is some redundancy between this position and the static K. Okay? One of the first things we see is, on the incorrect side of the slide there, is again a dropping of Bob's pelvis. We already know what this means. That means he's got a weak gluteus medius muscle. We can pick that up right away. Okay? Another thing we might see that we didn't see before is, notice on Bob's up leg, his right leg, you're seeing what we call a little bit of external rotation. Okay? That is a sign of also weak gluteals. And the reason that is, take a break, Bob, what you'll see is in light of a weak gluteus muscle group, we begin to recruit other muscles. Our body, as part of that reflex arc, begins to recruit other muscles to make up for our weak glutes. In this case, Bob is recruiting, and he's not doing this himself, this is just that reflex arc, a group of muscles that we call our small rotators of the hip. In this case, it's our external rotators. So his glutes aren't getting the job done, so Bob goes to plan B. He starts recruiting the rotators, and that'll manifest itself as a little bit of external rotation in that up leg. And that tells me right away, oh, Bob's got some weak glutes. In the second phase of the dynamic K, this is where it gets tricky, okay? This is where you really start to see some things jump out. Bob's trunk, hips, and left knee are coming into a forward, controlled, flexed position, okay? What we're looking for here now is any of those previous deviations. Let's eliminate the level pelvis because we already saw that. But let's look at Bob's stance knee. Okay, so on that left side, that left knee, if that begins to bow inward or assume that valgus position, which you can see Bob doing, and on the right side of the slide, we already know what that means based on the static K assessment. We know that Bob has weak gluteus maximus muscle. Now, you'll really see it here even more so than on the static K, because as Bob comes into that flexed position, the gluteus maximus muscle is really working hard to try to control that stance leg. So typically, anybody who has a weak gluteus maximus, boom, you're going to see it. And even through Bob's baggy shorts on the photo up there, you can see his knee really bowing inward, okay? So that's something else we'll pick out. During the final phase, or the end position of the dynamic K, Bob is coming into a full follow-through and a forward flexed position. Now, if you look at the slides, you can really see the difference in the two sides. On the left side, he's maintaining a pretty good posture in his back, okay? But on that right side, he's really coming into a lot of trunk rotation and flexion. Now, we've already pointed out that Bob has weak glutes. Sorry, Bob. What we're now going to point out is that he also has a weak trunk, okay? Specifically in this case, the trunk muscles that Darren alluded to earlier, the obliques, the deeper muscles of the low back, the multifidus, and the more shallow muscles, which you call the paravertebral musculature. That is where we're really going to see this, okay? So, take a break, Bob. What we've now seen just through the use of the static K and the dynamic K, which quick, easy assessments to perform, we know that Bob has some issues in his hips, and now we've indicted his trunk as well. Before we continue, you can take a break. I just want to tie some of the things that we found in assessing Bob. I want to tie them together with some of the things that Darren mentioned earlier. Okay, Darren pointed out that an athlete should be his strongest and most stable in his specific position of function. For everybody in this room, obviously, we're talking about throwing. We're talking about pitcher specifically. So your position of function is the entire throwing motion, all phases. That's where you need to be strongest and most stable. Now, we found in this case, by doing this assessment, that Bob has a weak gluteus maximus. I don't want to be redundant here, but I want to stress again that in light of what we found with Bob, Bob is going to lose velocity and power in his throwing motion because he's going to have difficulty generating or transferring the force from his drive leg through his glutes and into his core during the throwing motion. Okay, we saw that based on the research that Darren presented. Something else I want to point out that we found on this last slide, where we saw that Bob has a lot of excessive rotation and trunk flexion during his follow-through. Darren also alluded to the importance of trunk position and its effect on shoulder position and arm slot. Okay, if you have someone who has, whether it's weak obliques or weak multifidus, any muscles of the trunk area that are weak, what you'll typically see as they come through the cocking and acceleration phases of throwing, they're going to have rapid, okay, and excessive trunk rotation. If that happens, typically what you're going to see is they are leaving their arm, specifically shoulder and elbow, high and dry. Okay? That early and rapid and excessive rotation of the trunk is really exposing your shoulder and your elbow to a tremendous amount of stress. Dr. Zabat gave a great clinical example earlier. This is the young man that's coming into kinetic physical therapy with some early signs of medial elbow pain. Now, the first thing I think of when I have that kid present to me is, I'm thinking about his mechanics. Because obviously, we want to address mechanics, but sometimes I make what may be an unsafe assumption, and I assume that he's coming to either All-Star, or he's working with his coach, or he's doing something, working with his father in the backyard, and he's had at least somebody look at his mechanics and giving him some tips, and he's still having elbow pain. So right away, as a physical therapist, I'm thinking core. Because I'll tell you this right now, even if your mechanics are near perfect, and very few, except maybe Jesse over there, very few of our mechanics are perfect in this room, okay? Even if your mechanics are good, you are still exposing yourself to decreased performance and definitely increased risk for injury if you're doing it on a weak core. And I want to give you a number to think about, okay? The torque generated during a typical pitch or typical throwing motion is 7,260 degrees per second. That is a tremendous amount of force. If you don't have a stable base that force is being exuded on, okay, if most of that's being passed on to your shoulder and elbow, as Dr. Zabat will tell you every time, your shoulder and most likely your elbow are going to fail. They just cannot, those structures are not designed to withstand that type of force. That is why it's important that you have the core, okay, because it's that stable base of the core that's going to allow you to at least assume much of that force that's going on during the throwing motion. Okay, Darren stole some of my thunder earlier when he talked about crunches, but so I'm going to ask a question. It's a rhetorical question, but based on what we now know about the core and about exercise, do you think doing 500 crunches a day for the next 3 months is going to improve your performance on the baseball field? And obviously the answer to that is no, okay? Crunches are good if you want those washboard abs. Crunches are good for doing one thing, and that's more crunches. What we want to do is we want to figure out a good, functional, dynamic exercise that you can use to train and will translate directly to the field. You have those now using the static and the dynamic K. So we're going to transition now from the assessment of core into the treatment of the core. So if we use the static K example from before, Darren is going to take some tubing and he is going to place it around Bob's trunk, and all he's going to do is he's going to have Bob assume that static K position, and Darren is going to exude some force. He is just going to pull varying amounts of force, different directions. You can do this for 30 seconds, 60 seconds, however long before you begin to fail, before you lose posture. Because what we're telling Bob to do at this point is we're telling Bob to focus on maintaining his balance and maintaining good posture as Darren changes the direction of force. We call this a proximal challenge. Darren explained that earlier. What's happening here is because the force is being applied to Bob's center of mass or his core, it's more of a proximal challenge. If we want to advance this technique, Darren will lose the tubing, and now what he'll do is he'll have Bob assume that same static K position, and now he's going to begin by applying light and quick amounts of pressure along Bob's arms all the way to his fingertips. We call this more of a distal challenge, okay? The further the force gets away from the center of mass, so the further away from Bob's core that is Darren's force, the harder it's going to be for Bob to maintain good posture and balance. And we see this every day. We actually do this every day, we just don't realize it. If you have a heavy box in front of you and you pick it up, if you keep that box close to your body, it doesn't feel so bad on your back. If you hold that box out in front of you too far, you're going to get back pain, you're going to come to kinetic physical therapy. Okay? Same concept here. The further away that pressure is applied, the more challenging it's going to be for Bob to maintain all the things we talked about. Bob's thinking about here a vertical stance leg, a level pelvis, no trunk rotation, and arms equal and opposite. Okay, another exercise using the dynamic K concept is going to harken back to what Darren said earlier about proximal stability for distal mobility, or more specifically in this case, distal precision. Here Bob has a baseball, and Bob is going to perform multiple repetitions of the dynamic K while changing the grip on the ball. In this case, Bob's going from a 2-seam fastball at the starting position to a 4-seam fastball. Okay? The point here being, Bob is trying to achieve good core activation and control while executing the fine motor demands of the pitch that he's chosen. This goes back to that concept that Darren said earlier. Think about the core as a reflex arc. If you're on the mound and it's the 5th inning, the last thing you should be thinking about is, are my glutes firing? If you're thinking about that, then maybe you should be a first baseman. No offense to first baseman. Okay? But you should not be thinking about that. You should be thinking about your mechanics, fine-tuning your mechanics, hitting your spots and thinking about the grip on the ball. But if your core is beginning to fatigue and weaken, you know it. We all know it. We've all been there where we're digging deep, but we know we're starting to fade, okay? What we want to do when we train is we want to make sure that we are training to perform a task. So if Bob's doing this exercise, and again, manipulating the ball, changing the grip on his ball, whatever grip you prefer, from one to the next, and he is concentrating here on maintaining good posture and good control, what's going to happen is he is developing that reflex arc. He is training his core to do its job so that in the 7th inning, he's not thinking about his core. He's just thinking about making the pitches to win the game. This is a great example here, again, of task-specific training. Up off Bob. Okay, the last exercise, and this is by far the most challenging of exercises. Okay, so this is one that you typically want to do after you've mastered some of the other ones. This is through the use of tubing. We're going to use the dynamic K exercise. Darren is going to hand Bob the tubing. Bob is actually going to position himself in the end phase of the dynamic K. And what he's going to do is he's going to perform repetitions of the dynamic K with that tubing resistance being applied throughout the motion. And as you can see by Bob fumbling there, it is not easy. Again, think of the concept before. This is a distal force that's being applied. This is out at Bob's fingertips. So this is going to require a tremendous amount of stabilization on Bob's part. So this is one you want to work up to. Another example of this would be Darren will change the tubing and he'll go from above. So Bob will begin at the starting position for the dynamic K, and as he goes through that, now he's bringing the tubing down. Same concept, you're just changing it up. Next, guys. So as you can see, these exercises are basic. They don't require much. A piece of tubing, a partner, okay? The thing to remember with these exercises, it's all about technique. I'm going to say something that I think every one of us who's played a sport in this room has heard before. It is not that practice makes perfect. It's that perfect practice makes perfect. So it's not just about performing these exercises. It's about performing them correctly. If you have to do them by yourself, that's fine. But they're best done with the eyes of your coach or the eyes of a partner, a teammate on you, so that they can give you feedback about things like your stance leg isn't vertical, that knee's starting to deviate inward, or, hey Bob, your pelvis isn't very level, or you seem to be rotating with the trunk a lot. You want to make sure that you are training for your performance. That's the goal of these exercises. When you do them, you want to focus on technique. You want to focus on breathing. As Darren mentioned earlier, don't forget about the diaphragm. Diaphragm plays a huge role in core performance. And as we get tired, our breathing patterns change. So when you train, train like you want to play. Remember, if you do training right, if you do what you have to off the field, then game day is supposed to be fun, right? That's when you reap the benefits of all your hard work. And you can just step on the mound and sure, there's the pressure of winning the game, but at least you don't have to think about anything because you know you put the time in. That's what these exercises are meant to be. You put the time in, you trained your core, you're putting yourself in a position to not only be stronger, to improve your performance, but also from a clinical standpoint to reduce your risk of injury. So I hope our discussion tonight has given you guys at least something that you can take home, something you can start doing first thing tomorrow morning as far as enhanced performance on the baseball diamond. Darren and I will be fielding questions about each of the exercises during the panel discussion at the end. Beyond tonight, I hope that if you guys ever have any questions about anything regarding tonight's topic or injury prevention or a current issue that you may be having, that you'll call one of our 4 clinic locations and talk to any one of our wonderful staff therapists that you see up there. With that, I'll thank you for your attention, and I'll turn it back over to Chris.
Having me to host this event, and hope you leave here tonight with a little something that can help your son or a fellow teammate. If you're a coach, it can help some pitchers on your team. My goal for when Chris asked me to go over some or come up with a presentation for pitching mechanics, I kind of divided it up into 3 groups. I started with the youth pitcher, then moved into the adolescent pitcher, and then the high school and let's say beyond pitcher. I could literally sit up here and talk to you for probably 3 hours on pitching mechanics and different theories and different philosophies on things. Where I get, so you know, my information, I get my information from the last 17 years of teaching pitching lessons. I can promise you, probably nobody in the country has taught more pitching lessons than me. I've seen every type of thrower. from sidearm to kids who are ambidextrous, trying to teach them to pitch with both hands, and that's no lie. I've had 4 of those in my career. All the way down to kids who come in with their tail between their legs and need a complete overhaul, which does happen from time to time. So what we're going to start here is we're going to start with the youth pitcher. I'm going to start with flaws. Each of these age groups that I go through, I'll cover generically the same thing, and you'll see some changes as the kids get older and stronger. One of the things that I notice the most about younger kids is there's a lack of overall strength when we ask them to do things. Most of that comes, ironically, from the core, and I find a lot of kids, especially youth kids, have very, very weak hip flexors. They can't get off the mound, they can't stride, they cannot hold their legs up. That's a big problem, which ultimately leads to a lack of body control. When I say body control, stuff that might feel very simple to you and I, where, you know, it might be standing on one leg or not doing as advanced drills as, was it Bob?
Yeah.
Was doing? Bob, great job, by the way. But just very simple things and being able to be coordinated to do multiple movements at once, being able to control a glove and a baseball and a landing foot and a push-off foot. Another flaw as I see is the young players is their gloves are too heavy. And trust me, I know dads, if you guys watch TV in today's day and age, and I'm sure Jesse probably has one of these now, most of the big league pitchers that you see today will wear a glove that over the outside of it is mesh. It doesn't weigh anything. I know because my dad did it to me, and you guys probably do it to your sons, is the first thing that we do is we get their gloves and we oil them up, we dunk them in water. I don't know what the technique is today, but all we're doing is we're creating a really, really bad habit for young youth pitchers, because it's taking their glove and it's too heavy for them to hold up, and it creates a mechanic that over the course of 3 or 4 years of using that glove is very, very difficult to change, being the front side. Next thing is the kids throw too many pitches in a calendar year. Whenever I talk to parents and kids about pitching in general, I always use the term calendar year, because I do understand that kids will play baseball a lot of times for their schools, and then a summer team, whether it be a little league and maybe an additional travel team, and then they'll take lessons. So I always use a calendar year as a whole, and I'll kind of get into that a little bit later in the slides. And probably the most important thing is younger kids right now are specializing too early. They're not playing multiple sports. I know I played 3 sports all the way through high school, excelled at all 3 of them, and I probably wouldn't have been as good of a baseball player or a pitcher if I hadn't played soccer, if I hadn't played football, if I hadn't played basketball. Key phrases. These are key phrases to mention to a youth pitcher. Okay, direction. They will understand that. Obviously, just about on any pitching mound throughout the world you'll go to, is whether it's 46 feet, 50 feet, or 60 feet 6 inches, it's going to be in front of them. Use the term direction. Use the term athletic. When I say athletic, we just want them to do what comes natural to them. Have them just grab a ball, throw it. If you ever have a question about them being athletic and where they need to throw and how they need to throw, just play a really close range catch with them as fast as they can, and you'll see them be athletic. If you're questioning about where their arm slot is, make them play a game of fast catch. You'll find their arm slot very fast. The biggest things for me, and these all kind of go together, is keep your head still and keep your eyes level. I speak with a bunch of Little League coaches and guys trying to find that inside edge to pick the best Little League team that they can find, and I always tell them, listen, if you give me your entire Little League organization and I can watch a kid throw one ball, run, take one swing, and he keeps his head still doing all 3, I'll pick the best 12 kids who keep their head stills during those movements and their eyes level. Use the term go forward as opposed to pushing off. You know, forward makes much more sense than makes them go towards their catcher, go towards the batter, go towards home plate, and then try to give them a good rhythm or tempo. You know, if you're looking for a great rhythm, you can just give them a simple count of 1, 2, 3, 4, throw. or a 1, 2, 3, depending on the internal clock of the young man. Key phrases not to mention, okay, because these are phrases that can be interpreted by young youth pitchers differently. We can talk about front side. You know, if you start describing to a young man, hey, you need to get a little bit stronger with your front side. An 8 or 9-year-old kid has no idea what you're talking about. We as coaches might have an idea what the front side is, which for you guys who might not know what the front side is, it's the lead arm. We don't really want to talk about stride. Okay, when we start talking, we use the term stride, kids have a tendency to take that motion away from going forward to just taking a step. Always try to avoid the term arm slot or arm angle. They will find it. It'll find it themselves. Okay, if we start mentioning over the top or different things to them, or don't throw the ball sidearm, they're all built different, and they all came out of moms with one particular arm slot, and we just want to let them find it over the course of probably 3 or 4 years. I hate to use the term step towards your target. There's a lot of guys in the big leagues who step open, and a lot of guys who close themselves off and are very successful and don't have arm injuries, but their bodies have a tendency, that's just how they unfold as athletes. Try not to say bend your back or follow through. To give you an example, if you give me a 7 or 8-year-old kid or a 9-year-old kid and I tell them, hey, when you get done your pitch, bend your back. I mean, this is the same stuff that I heard, and I'm sure dads, you guys heard when you were growing up. That still doesn't make sense to me to this day. I don't understand what bend your back means. And then obviously throw the ball over the top. I've already discussed that. I put this on here, and I'll give you a little bit more background on it. If you can't read, I apologize. I'll read it to you guys. The average youth pitcher ages 7 to 11 will be 95% mechanically efficient before a Little League coach, parent, or instructor teaches them a single thing. This is due to the mind and body being able to figure out naturally the most efficient way to throw for their body type. Believe me, and this is ironic, in this academy here in particular, I used to teach in the first lesson tunnel closest to the field, and I used to give pitching lessons and pitching lessons and pitching lessons, and occasionally we'd have games out here with 9-year-olds and 10-year-olds, and I'd sit there in between lessons or in the middle of a lesson, and I'd have a high school kid who was 17 years old, and I'd say, listen, just look at the kid out there on the mound. Just watch what he does, and you're going to see 95% of what I'm trying to get you to do, he is doing naturally. They just come out. I think it's the body's way of protecting itself, and it's always going to find the most efficient way to do something. Checkpoints. For me, and safety points, I always look at a head. Okay? If you give me a young man who can keep his head still while he throws, he's always going to be a much better efficient with his body. He's going to throw more strikes, and he's going to last longer in games. I'll talk about the glove position at release. I like to call the glove position in particular, I like to call it the box. When a pitcher releases a baseball, I like to have their glove somewhere between their shoulders and their hips. And it can be high, it can be low. As long as it doesn't pass their body, we'll use the old term tuck, or things along those lines. As long as it stays in front of them, that's going to enable them to gain more ground or more direction towards home plate. If you want to think about it in a little bit more complicated terms, you can't go forwards and backwards at the same time. If I'm a right-handed thrower, which I am, and I take my left hand backwards and I take my right arm forward, I stop as soon as this passes my core or my belly button. If this stays out in front of me, it's going to allow my body to continue to go forward. It's a very easy thing to see in young pitchers. Posture. I always like to take a snapshot of a kid or even a young man who pitches for me, and I always like to kind of take like a mental picture, and nowadays everyone's got phones with video cameras and still pictures, is take a picture of your son in the first inning and see what his posture looks like, because that's when he'll be his strongest. That's when his core will be its strongest. and then take a picture of him in his 4th inning. I can tell you if his posture is the same in the 1st inning and the 2nd inning, you can let him pitch. If his posture changes, okay, he might start to lean one way or the other. He might have a hard time keeping himself up at follow-through. Call timeout, get down to the coach and say you're coming out of the game. He's done. At that point, he's fatigued. If he's strong enough to make it to the 4th inning, check his 4th inning posture. If he's good after that, take him out. Because more likely in young kids, four innings is plenty. I can tell you for the level of kid that I coach, kids who have pitched for me in the past, the most anybody has ever pitched in a single game is 4 innings and 70 pitches. That's just my rule. But at my level, the kids are trying to get scholarships and pitching for college coaches and whatnot. And a pitch count. This is a rule that I've always used. I like to take the pitcher's age and multiply it times 100, and that'll give you his calendar year pitch total. It's always seemed to work. I know a lot of college programs that use it. You can just write that down and keep that in mind. When I say in a calendar year, we're going to use a competitive pitch. In a non-lesson setting, we're talking in a game, pitcher, catcher, umpire, the whole thing. The adolescent pitcher. I like to use this between the ages of 12 and 15, or depending on when a young kid has hit his growth spurt or puberty. This is always an interesting time, and especially for someone like myself or someone who's known a kid long enough, their bodies change incredibly fast. And more than likely, they'll go through a period where they can't even catch a baseball and become so uncoordinated because their bodies are growing so fast. And it's important that their mechanics at this point don't change and we stay consistent. So here are some of the common flaws out of the adolescent pitcher. We have a lack of coordination. And this comes, once again, from kids. I've seen kids that walk in here, Coach Manning, how you doing? Good to see you. They leave. Next thing you know, they come in and they got a beard. And I'm like, what happened to you? And they can't play catch anymore. They're a little uncoordinated. They look like a young fawn just born, gangly and uncoordinated. This usually has a tendency to create a lack of pitch command. And this is where we as instructors have to be very diligent about the drill work that we do. Everything has to be repetitive, trying to create a consistent delivery, consistent arm slot. Usually about this time is when they start to get introduced and they understand what a radar gun is. Unfortunately, ESPN starts it with the Little League and have the radar gun and the comparison and all that stuff. And they might start to see it at the College World Series and everybody's flashing the radar gun. I don't think you can turn on a baseball game on television now without a radar gun somewhere. They also throw too many pitches in a calendar year, and this is where they're also forced to play another position and pitch. This has a tendency to happen usually around this age. Your best pitcher is usually your shortstop or your center fielder, or God forbid, your catcher. We always want to make sure that those kids, after they get done pitching a certain amount of pitches, that we give them enough time off for their body to recoup. Another thing is these kids have a tendency to find the weight room a little too early. Some of the problem with these is sometimes your football coaches grab these kids when they're freshmen in high school and say, let's go. Next thing you know, they're lifting like Olympic lifters and all the Olympic movements, and they just get too big and too strong and lose a lot of flexibility. Here are some key phrases to mention to an adolescent pitcher. Obviously, we always want to repeat the head still and the eyes level. I like to use the term control your body. This is the biggest thing that you're going to find, is control your body, be consistent, and repeat your delivery. Keep in mind, at this time, we don't have to do this stuff on a mound. You can do a ton of this work on flat ground just playing catch. Key phrases not to mention. Once again, based on the radar gun, we're starting to get into velocity. We don't care about velocity. Arm quickness, get stronger, arm strength, have to throw strikes. All of these things, we don't want to start planting these seeds in the kid's head. I had a great conversation with my sister Kirsten, who's the head women's lacrosse coach at Duke. And obviously at Duke University, they have an incredible support system, and their coaches go through training with their psychological staff and sports psych staff about what to not mention to kids. And you know, she has a difficult time. She knows the old thing, bigger, stronger, faster. But we don't want to say these things to kids because they know they know they need to get stronger. They have to get faster. Their arm needs to get stronger. But that has a tendency for them to want to be able to take shortcuts and find different ways to take shortcuts. So we definitely don't want that. Mechanical and safety checkpoints. A lot of these you're going to see are going to be the same because we're just talking about pitching. It's head position, glove position at release, first inning posture, fourth inning posture, pitch count, and then I added a sixth one here. And I like to look at the posture and then look for any drop in the shoulder blades. This is a huge thing, an easy thing for me and our instructors here at All-Star Baseball Academy to see. You know, with everything that everybody's talked about tonight from a PT standpoint and a medical standpoint, I could see a kid come in here and he walks in, he's a right-handed thrower, and he comes in and he's walking in like this. You know, I know personally that within probably the next 3 or 4 lessons, even if I agree to do it, that kid is probably going to have some elbow stiffness, some bicep tendonitis or something, and he needs to go see a physical therapist to be able to strengthen the muscles in the scap, you know, to build that back up and to get some strength. Parents, if you see them with their shirts off, just take a peek at them, and if their posture's off, one way or they're leaning towards which way they throw, definitely probably go in and take them into Kinetic and see somebody and just have somebody get it checked out as quick as possible. All right, the high school and showcase pitcher. This is when things start to get interesting. I'm going to use the lightning bolt theory. This is a term that you'll hear a lot from college coaches and pro scouts. Basically what this means is some kids are just genetically gifted. Mom and dad, their chromosomes matched up. Mom pushed out a baby that if that kid eventually figured out how to throw a baseball, it was going to come out of his hand in the upper 80s to low 90s. I can tell you personally, I've seen it over and over and over again. A young man who unfortunately is no longer with us, I've had an opportunity to work with, is a kid, Nick Aidenhart. He's a young man who pitched for the California Angels, played for me for 3 years. Took some lessons in here once he moved up here from Maryland to Delaware, and his dad came in and said, "Mike, I want you to give him lessons." And I'm like, I'm not going to touch him. Why would I touch him? You know, he is as good as can be. He's going to be a first-round draft pick. And who taught him how to pitch? And his dad's like, I don't know. That's how he always threw. And that would be the lightning bolt theory. You're also going to deal with genetic disposition. Okay? If a high school pitcher is disappointed in his velocity by the age of 16, 18, he has to understand that it's not his fault. He can only work with the genetics that he's been given. Okay? More than likely, if mom and dad were both athletes, the kids are going to be an athlete. If someone in the family was 6'8" and the kid comes out 6'4" or 6'7", it's going to happen. You know, the arm sometimes is only going to go as fast as it's genetically meant to go. High school mechanical safety checkpoints. Once again, you're going to see a lot of these the same. The head position, glove position at release. The inning posture changes here a little bit. The first inning posture and fifth inning posture. High school coaches and people have a tendency to let these kids run them out there. They're their horses. They're going to win the game. They're going to win them the state championship. They're going to make everybody famous and in the newspaper. It doesn't matter. We're checking posture. If posture falls, if they lose their balance, head starts falling, body starts falling, we're pulling them out of the game. Obviously, pitch count. We're going to look at the shoulder blades for any drop. And we're going to start to get a little bit more into the mechanical perspective of equal and opposite, which is your front arm and back arm, and landing foot consistency. You might ask yourself why I kind of left this real specific mechanical stuff till the kids get to high school. That's because I hope that the kids at the younger ages, we just let them throw. We don't mention anything to them. Just let them develop their own arm slots. Let them develop their own mechanic for their body type and their genetics. Then they're going to go through the next phase where they're going to be gangly little fawns, you know, going through puberty, where they're just a chemical nightmare inside of us. We've all been through it. You know, so by the time they get to high school, they've started to shave, they're starting to get strong, their man muscles are starting to come. We can really start to kind of zero in on a few things. At this point, they're still little rubber bands. You can teach them, you can move them, you can ask them to do different things, and they can make the changes relatively quick. So here's some basic photos so you guys can see of some of the things I talked about tonight, which is mechanical and safety checkpoints. Start at the top left. Obviously that young man's glove is too heavy. Okay, you can see how it's almost pulled his entire body to the side. Okay, which is bringing his posture off, his arm off. The next picture, moving forward, is a great glove position. You can see it's between his shoulder blades and his hips. Okay, but his head is, you know, he doesn't have a level head and his eyes are to the side. Moving to a high school kid with a great glove position and a great head position, you can see his eyes are level. And then I like to add in a major league pitcher in here with a great glove position, you know, and a good head position. Talking about the equal and opposite, I think it's probably about the third time you've heard that term tonight. It's just, we just want the front arm and back arm to be an equal and opposite distance from each other. And that's a youth pitcher with a great picture. An equal and opposite out of a little league guy right there. A kid from Air Force, I think it's where I stole that picture from. A college kid who looks completely different, you know, and then a big league pitcher who looks completely different as well. Equal and opposite can be, I like to call them straight, straight, short, short. As long as the front arm and the back arm are usually the same distance from the core, you're going to have usually, we'll call that as mechanically efficient for each kid, and every kid's going to be different. And that's what I have for you tonight. Thanks for your time, and I will be around later for the panel discussion if you have any questions. Thank you.
But unfortunately, my genetic disposition was about 65 miles an hour and a big looping curveball that got hit all over the place. So anyway, I became an athletic trainer and a physical therapist instead. So I guess really my preface behind putting this talk together was that inevitably, no matter where I go, I always get asked basically the same questions, which is, you know, when can my son throw a curveball, or when can my son throw the slider? So when Chris Shearer and I started talking about doing something like this 4 years ago, I think, I guess I'm finally going to get a chance to get on the soapbox, talk a little bit about it. Unfortunately, I had to present the research that's behind it so that everybody kind of understands where I'm coming from with it, and then try not to make research boring for everybody tonight, but go over that a little bit. Try to clear it up, at least in everybody's mind tonight. Anatomy, these are the things that I'm concerned with. You know, I don't want your son or daughter to come and see any of these guys, Dr. Zabad or Chris or any of these guys, because of a rotator cuff problem, a labrum problem, a bicep tendon problem, you know, any concerns with their scapula. We just had a talk about kids walking in with a low scapula. You know, that's something that all of us can identify and try to treat before they get on the field. The shoulder injuries, impingement syndromes, rotator cuff problems, tears, you know, these are all the bad things. These are all the things that we want to prevent. We want to keep the kids on the field. We're going to try to find ways to do that, and this is one of our ways of trying to do that, is talking to you guys this evening. How about the elbow? Every time, you know, pick up a paper and read about the Phillies, you know, we got a player with a flexor pronator problem. Unfortunately, some of that is age-driven. You know, like, for instance, we have Jose Contreras, who had a flexor pronator repair in the offseason. I can say that because it's in the news. I'm not going against his HIPAA rights about his medical care. But, you know, there's a time and point where things break down. For your kids, that hasn't happened yet. So we need to find ways to prevent these kind of things. Flexor pronator muscles, everybody knows what they are. They're these muscles on the inside of your forearm. When you think about what they do, they help finish the pitch for you, but they also create stability in your elbow. Everybody thinks about the Tommy John ligament. Well, we'll talk a little bit about the Tommy John ligament later, but stability comes from these flexor pronators also. The extensors, actually what you do is you look at a research study, what happens to the extensors. When you get yourself up in the cock phase, if they contract too soon, they actually will help when you do it on a cadaver. When you bring them up here, they actually gap the joint open. So they kind of open the joint and put more stress on the ligament. So the timing of what's happening between flexors and extensors when you're up in this position is really important as to what's going to happen to the stress on your elbow. Bicep tendon, the ligament we talked about, Tommy John ligament, and of course also the bony things. Our players unfortunately get bone chips and all kinds of things. Dr. Zabat showed a great CT scan, a couple x-rays of just different changes that happen in the elbow. He talked about OCD and what happens in young kids, but we see it on our end where they get these repetitive stresses, and all of a sudden you hear somebody getting a surgery to have loose bodies removed, bone chips, and those kind of things. The ligament. This ligament is not really meant to take on the stresses that we give to it. So if you look at research studies, they give nice numbers like 14 Newton meters, which for me really doesn't mean a whole heck of a lot, except for the fact that they also say that the stresses that come through the elbow on the ligament are around 45 to 50. So that's really all I need to know, is that that ligament is not prepared for what we ask it to do when we throw a baseball. Throwing a baseball, whether we like it or not, is not a normal act. Throwing a baseball and raising yourself up under a mound is even more or less of a normal act and more stressful of a normal act. When we have players coming back from rehab, a lot of times what you hear is, oh, the guy's he's throwing flat ground, he's doing great. All of a sudden you raise him up on that mound and everything goes right down the tubes. It's amazing just that little height, what happens to the stresses on the elbow, what happens to the stresses on the ligament. These are the things that need to be addressed prior to your kids throwing a baseball. So we're fortunate. I got 14 athletic trainers that work with our staff. It's very easy to accomplish all these things. So let's start with what happens at the shoulder. At the shoulder, you lose internal rotation of your shoulder, you start to gain external rotation. When you compare the throwing side to the non-throwing side, when you start to have significant changes between those two, your kids are at risk. Again, Dr. Zabat showed a nice picture of what happens to the growth plate in the shoulder. That bone also rotates a little bit as you become decided on which side is going to be dominant, and that predisposes you to having a little more external rotation. But again, it shouldn't get way out of whack there. Mike just talked about coming in and seeing a pitcher with his shoulder down low. We have a nice fancy term for that, scapular dyskinesis. When you take your son or daughter or kid, careful, make sure the parents are aware you're going to take their shirt off of them. We don't want you to get in trouble. You take their shirt off and look at their shoulder blade, and on their dominant side or throwing side, you see significant differences from their non-dominant side, they're at risk. Real simple thing. Don't have to be a doctor. Don't even have to stay at a Holiday Inn Express last night. You can do this. Core deficits. We had a nice talk from Darren about core deficits and what they mean, easy ways to test them. They've been demonstrated to you tonight. Something easy that you can just pull out, do. Again, don't have to be a doctor to do it. Looking at what's happening in their lower extremity flexibility. Again, Mike talked about kids who go through growth spurts and what happened to them. They look like baby giraffes when they're born. What's going to happen to their flexibility is some things grow, some don't. They get all these little things like Osgood Slaughters and Sievers in their Achilles and ankle where they start to get these different pains. Again, these are the kids that are going to change, and when they start to make those changes, it's our job to identify the problems with them. Spinal mobility, same thing. All of a sudden, you'll see a pitcher who, when they stand there and we take posture pictures of our guys, I can rotate them this way. They're good in the windup. Sorry, I got to demonstrate left-handed because it's my deficit. But if I stand here, they're good here, their follow-through, this is as far as they can rotate. We got major league pitchers that look like this. So if our guys look like it, I can guarantee that our kids, our high school pitchers, our college pitchers are going to look the same way. And then what happens is you take somebody and throw a baseball or swing a bat in the same direction over and over and over, our bodies adapt to that. And our job, when we look at them on a screening standpoint, is to try to figure out where that asymmetry is going to happen and how much of it we can change. Some of it we don't want to change. Again, I keep referring to everybody that talked because I want to pull points out, but Mike talked about the fact that not every kid is the same. Not every kid's going to throw like Greg Maddox. Not every kid's going to throw like Cole Hamels. And that's a good thing. We want them to throw like what's best for them. But there are certain things that we can identify. There's this range of problem that we can identify with some of the screenings that have been talked about tonight. Unfortunately, now we're to the research part, but I picked 7 studies of, God, I don't know how many studies are out there, but I picked 7 that I thought would both be most applicable to the things that I want to get through tonight. So the first study, this is a study that looked at the risk factors for elbow injuries among young players. One thing to look at in all these studies is what's the age of the athlete that we're looking at. So you're going to, there's some talk about the curveball and the fastball and what's the differences. You got to look at the age of the athlete they studied. That's very important. So we're looking at 9 to 12-year-olds, and what were the things that made them most at risk for elbow injuries? Well, the first was a decreasing amount of shoulder external rotation. So how far can they get back here? And that doesn't mean you go home and start stretching your kids back into this position. It just means that when we identify it on one of our screenings, that's something that we have to be aware of. Increasing the amount of strength. Mike mentioned that one of the things he sees is that kids aren't strong enough. Sometimes the stronger kids who throw harder are more at risk than the kids that are a little bit weaker who throw more consistent. Age, greater than 11 years old. After the age of 11, your kids are most at risk. So, when they're 8 and 9, they got better flexibility. They got a little more flexibility at 10. Now what happens? They're starting to get through that. They're get towards puberty, and things are starting to change. So the kid, after the age of 11, was most at risk. Pitcher, makes sense. Throws the ball the most, he probably is most at risk. Training 7 days a week, that makes sense. There probably should be a recovery day somewhere in everybody's training program. And then the number of pitches that kids were throwing that were most at risk was somewhere between 70 and 90. 1 study down, 6 to go. Correlation of throw mechanics, elbow valgus load. So what is elbow valgus load? Elbow valgus load is the amount of stress on the inside of your elbow. When that elbow starts to gap on the inside, that's valgus load. For an adult baseball pitcher, adults, we're talking about adults here, so this is not kids anymore, but some of this information is definitely going to apply to kids. So, talked about this earlier, the peak torque on the ornitholateral ligament, 50 Newton meters, and when you do a cadaver study, because we don't want to do this to live people, that'd be pretty bad if we took the ligaments and start tearing them, there's only 14.9 Newton meters. Again, what gives it the stability? Well, you get some bony stability from the joint, you get stability from the muscle, and certainly the ligament plays a part in it, and also the timing and the mechanics, which is outside of my realm of expertise, but those kind of things can all help limit the amount of stress on it. Things that increase the valgus stress. Initiating trunk rotation before the stride foot contacts the ground. So a lot of people call this flying open. I don't know if that's the term Mike uses, but for those that don't teach lessons, that's what I would call it. The side, so the side arm or the 3/4 slot, much more stress. If you look at it from a study, much more stress when you're down sidearm than you are 3/4. So the arm slot or where you pitch is important. And then an increase in the amount of shoulder external rotation. So this is a little bit different. What we saw in that younger study was lacking external rotation. Now in the adult, having too much external rotation. So a little bit different. What to evaluate to decrease valgus stress? Well, increasing the amount of elbow flexion and ball release. Obviously, we don't want the kid releasing here. There's going to be a little bit of bend here, a little bit of protection to the joint. 3/4 arm slot is going to be important. And again, I know Mike said you don't want to teach it, but I'm just giving you what the research is saying. And then the amount of trunk rotation initiated. So again, trying to stay closed, get the foot down, begin the rotation, use all your forces from the glutes and your core to help generate the forces through your arm. So relationship between throwing mechanics and elbow valgus in professional baseball pitchers. Now we got a little older group. First of all, elbow pain, the most common complaint among any of us, whether it's adults or kids. And there are 4 things that you looked at for the amount of variance in elbow valgus stress. So shoulder abduction angle, so that's the angle here from your body. How far do you have it here? Is it sidearm? Is it 3/4? The peak shoulder horizontal adduction angular velocity, so how fast do they bring this forward into this position? The elbow angle when they release, so where is this at again? And then how much external rotation torque did they have? How about association of maximum pitch velocity, because that's always the question is, I want my kid to throw harder. But association of max pitch velocity and elbow injury in professional baseball pitchers. Again, older group. Looked at 9 injured players and 14 uninjured players. Injured players had a greater velocity than the uninjured players. The career length, however, for the guy with the better velocity was longer. Wonder why that is. You know? I mean, everybody looks at the radar gun. Yeah. To me, I would much rather, if we were going through the draft, sorry Jesse, this may or may not apply to you, I don't know where this falls, but if we were going through the draft and somebody had to ask me what type of pitcher would be the best to draft, I'd rather draft the guy that knows how to control his pitches as opposed to the guy that can just throw 97. Makes much more sense. He's got much more pitchability. He's probably got a better chance of staying healthy. But unfortunately, that's not always the case. Scouts really like to do radar guns still. Consistent with, so the studies that had already been done, Glenn Fleissig, who's out of Dr. James Andrews' facility down there, looked at, there's no load difference between throwing a fastball and a curveball on the elbow. Again, we're looking at adult, major league, or professional baseball pitchers. There's a study done also that looked at the load on the elbow and the shoulder are greater with the fastball. And this is where some of that story comes out that, oh, you know, it's okay for my kid to start throwing a curveball. There was a study out that said there's no difference in the stresses. That study was done on professional pitchers. There's a reason it wasn't done on 9 years old, 10 years old. So that's where, like, somebody reads a study and then all of a sudden they apply it to 9 and 10-year-olds. That's not really going to be a good thing. The one problem in this study that didn't happen is what happens over the course of the game. How about fatigue? How about their position? First inning posture, fifth inning posture. You know, where are they at? About 10 points, I bring up relationship between ball velocity and throwing mechanics in college baseball pitchers. So, which kids throw the hardest? Well, kid with the bigger body mass. Makes sense. We see that in Little League, right? Bigger kids throw harder. Shorter interval between stride foot hitting and the amount of external rotation. So when does this hit and when do they get back here at the right point? Knee flexion at stride, not throwing over a straight leg in front. You know, you're not going to have that real stiff leg up front and try to cast over top of it. Amount of increasing elbow flexion, so not being here, being a little more flexed. The later their head moves forward. These all sound like things that Mike could probably address better than me. Increase in maximum external rotation. Again, maximum external rotation, but talking about the college pitcher. All these other things. So 8 and 10 go with Darren's talk about core strength. Increased trunk angular velocity, so how fast did they get their trunk to move forward over top, and how much increase in forward tilt did they have? So at release, where was their trunk? You know, were they back here trying to throw, or were they trying to get out in front? It's kind of nice, trying to tie everybody's talk together here best I can. Biomechanical comparison of the fastball and the curveball in the adolescent pitcher. So, adolescent, 16.6 years of age. Again, we're still not talking about the 10-year-old that wants to throw the curveball, or the 11-year-old that wants to throw the curveball. We're about 16 and a half years old. Fastball velocity, 65.8, curveball velocity, 57.7. So again, this is not great hard throwers we're talking about here. The study included older adolescents since there's less variability in their throwing mechanics. Less variability in throwing mechanics. Again, to me, and I'll talk about it later, is if they can't consistently throw a fastball, why would you think that all of a sudden you want to introduce something else, like a curveball or a slider? The other thing is, increase in the amount of moment, so more stress on the fastball than the curveball. Well, okay, the velocity is less, so most likely the stress on the elbow is going to be different also. You're talking about a 10-mile-an-hour difference between the two. We're talking about a college pitcher. But again, this is where this one point in this study gets pulled out and people go, well, there's more stress on the elbow if you throw a fastball than there's a curveball. Well, yeah, makes sense. We're talking about college pitchers. Nobody wants to study the 9 and 10-year-olds yet on this. About kinetic comparison on fastball, curveball, changeup, my favorite pitch. I'm a little biased to it. Slider in college baseball pitcher. So curveball has less elbow force than the fastball. Again, one little point that comes out of the study that gets talked about, talking about college pitchers. The slider could be the worst pitch to throw, obviously. It has greater forces than the fastball. The changeup has less on internal rotation forces, shoulder abduction, shoulder adduction, trunk velocity, force at the elbow versus the fastball or slider. Change-up's my favorite pitch, by the way. Because if it's good for college kids, then it's probably going to be okay to throw for a younger kid if it creates less stress. Same thing, some previous research under this same study. Youth and high school studied, no data for the curveball, the changeup, or the slider, but the concern was for the variability in mechanics. So no one studied in young kids because they don't like the fact that they vary their mechanics and they can't consistently look at them. Of 476 youth baseball players that were looked at that threw a curveball or slider, they were more likely to have shoulder or elbow pain. And high school pitchers requiring UCL reconstruction or the Tommy John surgery, 2/3 of them indicated throwing a curveball prior to the age of 14. So I think we're starting to get down to my point, which is about, can my son throw a curveball or not? But if you're not sure and your kid's under the age of 14, this is one to think about. How about summary for me? Elbow symptoms are the most common thing. They shouldn't be ignored. If your son or daughter or kid on your team comes to you and tells you they're having elbow pain, do something about it. Don't ignore it. Don't tell them throw through it. Don't tell them rub dirt on it. Whatever you want to do, don't ignore it. It's important to remember that pain comes for a reason. Now, if he's having a bad performance and he begins to have elbow pain and all those things, you think he's just a wimp, just be careful of that. Be very careful of that. Because even in the major leagues and professional baseball, we sometimes think some of our guys are full of stuff. We got a lot of kids in the audience, can't say what I really want to say. You have to be careful of that. Take the time to evaluate it, make sure it's legitimate. If it ends up next day he feels great and he's back throwing the ball hard, fine. Probably was what you thought it was. But don't ignore it. Remember, the stresses on the auriculateral ligament are much greater than what it can tolerate. You have to respect that. If your kid's older than the age of 11, they're at an increase in risk to have injuries to their shoulder and elbow. Current studies have evaluated pitchers at 16.6 years of age or older since they're more consistent with their kinematics. So they're more consistent with their mechanics. They're being taught to them. That's why they're being studied. No one has the guts to go and put a 9, 10-year-old and start throwing curveballs with them and put them in a study. And for good reason, they don't. The forces are greater at the shoulder and elbow with increased velocity in rank order, fastball, curveball, and changeup. We already talked about this last. High school pitchers requiring UCL reconstruction, 2/3 of them threw a curveball before the age of 14. So here's the common sense part. Know the risk and indications of a problem. The first risk is they're picking up a baseball. Kid picks up a baseball, he's going to pitch, he's going to throw, he's at risk. Understand that. The rationale for the studies using older athletes is because they're more consistent. You know and I know that 10-year-old kids pitching and 11-year-old kids pitching are not consistent. They can't throw a fastball worth of crap inside and out. We have to be aware of that. Same thing as they get older. If they can't consistently throw fastball, inside corner, outside, probably not a good chance that they're going to be ready to throw any other kind of pitch. The changeup has been proven to be the least stressful pitch and most effective. Let's see, Cole Hamels won 2008 World Series MVP. We won the World Series, which is really great. And if you look at his performance over the course of that year, his curveball stunk. He had a fastball and a changeup, and he'd throw a looping curveball every once in a while in there just to get him to think about it. But it really wasn't a great pitch for him. It's a much better pitch for him now than it was then, which is good. He also now has a cutter, which is even better. He's an adult, so we're not talking about a kid here. But again, makes sense. If he can be successful in the World Series with a fastball and a changeup, then I think our kids could probably be just as successful with a fastball and a changeup. Protect the athlete. Screen him before each season. I don't know what the resources are, but there's a lot of people that came in here tonight and talked to you about a lot of things. If you have a concern for your kid, you're not sure what to do, just get them screened. It's a very simple process. All the things we talked about in that initial slide. Having somebody measure how much shoulder motion they have, somebody look at how much core strength they have, look at their lower extremity flexibility. It's It's a real simple process. You have a really good athlete, whether you have an athlete who you have concerns for injury, they've had previous injury and now they're coming back, just get them screened. It's very simple to do. Understand the symptoms are a sign of a problem, don't ignore them. Progress them based on their skill, not their desire. How many times does a coach get asked, hey, I want to learn how to throw a curveball? And somebody thinks that's a great idea, or their dad thinks it's a great idea. Base it on their ability to be able to do it. They can't throw a fastball, they don't have good fastball command, they're probably not ready to do a curveball. Again, it's all about just thinking about what's best for the kid. The end is near. Any questions?
Portion of our night.
Get ready, guys.
Well, the one person that I haven't had an opportunity to really introduce here, other than just kind of saying his name on the slide, is our good friend Jesse Biddle. So everybody give a nice round of applause for Jesse Biddle.
How you guys doing?
I wanted to give you just a quick moment to kind of talk to the folks and just give them an idea. And I had an opportunity to hang out with Jesse just a little bit, and he said something to me, just in the course of conversation, just about his travels thus far, where he's come from and where he is now. He said that his senior year, and I'll probably get these numbers wrong, but it'll be pretty close. Senior year throwing a baseball in high school, he pitched about 55 innings or something like that. Maybe it was 60 innings. And his first year professional baseball, he threw 120. Is that about right, Jeff?
135.
135. There you go.
Get specific with it.
There you go. And I will tell you, if I have the unfortunate opportunity to evaluate one of your kids that are throwers, not that they would be unfortunate to hang out with it, but I always ask every youth pitch, do you know how many innings you threw last year? And you'd be surprised how many people have no idea. But just speak a little bit about, obviously the work you've done to get where you're at, and how it has changed, to stay where you're at.
Yeah, I mean, there's a lot of work that goes into it. I'm not going to lie to you guys and tell you that it's easy. First of all, let me just say that by going to something like this, you're already taking the necessary steps to further your kid's career. I learned a lot from just sitting here, and I'm actually really glad I attended it. So the work that I've had to put in, I didn't really understand until I was in high school. And I had a trainer who was pushing me and telling me that this is what I need to do. And I think that's something that's really important. As a parent, and I'm guilty of this as a kid, I don't really listen to my parents that much. And they tell me the right stuff, and I'm not saying that, but it is nice to have that outside perspective. So to have, a trainer or a coach or somebody who your kid trusts, it's something that is really important. But when I joined the Phillies, I didn't really realize how much extra work I needed to put in. In high school, you got to worry about homework and you got to worry about social life. But when I joined the Phillies, I mean, they preach conditioning. They tell the players pretty much every single day that we do the extra 10% that other teams don't. And I really think that is such an important way to believe and such an important philosophy, and one of the reasons why they're so, they're so successful at the big league level. So there's so much conditioning, as well as lifting and dieting. It becomes a way of life, and that's something that I've really had to get used to, but something that you have to enjoy. I mean, the biggest thing that I think I can tell a kid is that you have to want to do this, and you have to want to put its effort into it if you want to succeed. So yeah.
Wonderful, wonderful, wonderful answer. I want to ask a hard-hitting question to get this thing started, and then I'm opening up to everybody. Mike Mann, do you feel like we need to consider like an intermediate distance somewhere along the developmental phase of playing baseball? You go from the 45-foot throwing distance to 65 or 60 feet 6 inches. Do we need to find somewhere in the middle, do you think, that our youth pitchers can play at a certain that intermediate distance before they're graduated, so to speak, to 60 feet 6 inches?
I think we're kind of getting there with, I guess it would be called Cal Ripken baseball at this point. They're becoming pretty prevalent. A lot of Little League organizations are going to them, and they've changed the distance to 50, 70, I think starting at 11. Danny, am I right on that? Yeah. I think at 11 years old, which I think does help a lot. I mean, if I had my perfect wish, I'd just eliminate the mound. Make them throw a flat ground till they all have beards. To be honest with you. I mean, the mound is, if you really think of a throwing athlete, everybody that throws, whether it's a tennis player making Andy Roddick making a 170-mile-an-hour serve, or a javelin thrower, or a football quarterback. I mean, the common denominator is they don't get hurt because they're on flat ground. We put kids on the mound and they break. Because the forces are just, I'm not sure exactly the forces. You guys would probably know more than me, but I think it's 6 times your body weight going down a 10-inch rise.
Yeah, I would believe it. The floor is open. Hand up, and we'll get you a microphone. We're gonna do like Phil Donnie.
Scott, on one of these charts that you had up, there was something that seemed to mention that when you throw sidearm, there's more torque on the elbow. So as a youth coach, I've always been under the impression that throwing sidearm was less dangerous for your arm as opposed to for your shoulder overhand. But is there then more torque on your elbow when you're throwing sidearm?
Yeah, I mean, I think you're referring to the one study. So the one study said there's actually like 66 Newton meters of force with a sidearm position as opposed to like 40-something with a 3/4 slot position. Again, you have to take research as to it's one moment in time and one study, but I mean, in general, that's what is believed. And much of that may have to do with the position of the elbow and not having as much flexion in it, as opposed to what would happen in a 3/4 slot position where you have a little more elbow flexion and therefore you lessen the amount of stresses on the elbow.
For the panel, in one of the slides there, you had a thing about the weight rooms, and they're starting to work with weights and all that. Is there some kind of guideline of age, or why would they? Is it because they hadn't reached puberty yet? Can you expound on that? And if they should go with weights, should it be based on a percentage of the body weight, or whatever the kid's capable of handling?
I think you might be referring to Mike's talk where he talked about kids getting in the weight room too early. I'll start and someone else can join in wherever they want. So I don't think there's any point where it's too early for a kid to begin exercise, but it may be too early for them to begin lifting, as far as heavy lifting. So I guess the best way for me to put it is, they can work on their core, they can work on their cardiovascular stuff, they can work on getting stronger, but I would do most of that with like body weight type exercises where they might use either like push-up, or they might use like a TRX device. I don't know if anybody's familiar with that, but a suspension type device where they could use that to control how much body weight. Or if they're going to use weights, you're going to have them performing things where they're doing higher repetitions. They might be doing like 15 repetitions with a weight or 20 repetitions with a weight. Remember, baseball is an endurance activity. When we run into trouble is because the muscles fatigue, and the muscles fatigue because of the repetitions that we're asking them to throw. So it doesn't really make a whole lot of sense as far as in-season training to do a whole lot of lifting that's going to be heavy. So there's no reason, particularly for young kids, that they can't do higher rep activities and less weight.
The big thing with lifting weights is you have to get to a point where you're doing it right. It's not as much weight, it's doing it right. And that's the biggest problem with anybody lifting weights in any gym. You go to LA Fitness, you go to ACAC, anywhere. You walk in and the first thing you see is people lifting a lot of weight, but just terrible form, and it's just bad. But they walk out thinking, boy, I can do X amount on a leg press, or I can do X amount on a squat. And that's bad. I mean, if you take a look at gymnasts who are some of the best athletes in the world, and look at their musculature, they don't pick up a weight, I assure you. They pick up nothing but their own body weight with a tremendous level of core stability. Another one is dancers. Take a look at professional dancers. Tremendous body, tremendous strength and core stability per pound, never pick up a weight. And that's the biggest thing. So think about what you're trying to do. Think about what you're trying to accomplish, which is to make your athlete stronger, to make your young lady or young man stronger. It's not about can you do that with 100 pounds. It has nothing to do with 100 pounds. You can get plenty strong with a 5-pound dumbbell and the rest of your body weight. You don't even need the dumbbell, really. It's just a matter of, don't walk out of the gym going, that was 50 pounds, I'm strong. It has nothing to do with the weight you're doing. It has to do with you being able to accomplish the motion.
How you doing? I have a question about warming up, especially in the youth players, for pitchers. Can you explain how much of a warm-up you would like to see pitchers? I guess this is toward Mike. And long toss. I heard some conflicting things about long toss. Do you recommend a long toss for pitchers?
From a warm-up standpoint, I mean, here's the big thing for me. I mean, is you have two different types. You have your dynamic and your static. I think a lot of these guys will tell you your static stretching is kind of going away for the most part. I like to think about my kids, especially the youth kids warming up. They're rubber bands. I mean, they're flexible. I mean, really, have we ever seen a 9 or 10-year-old kid pull a hamstring? I mean, they're pretty much ready to go, but I like to get them breaking a sweat or increase their core body temperature by degrees before they do anything or they even pick up a baseball. I also like, personally, to have the kids do a 30-second shoulder rotation forward and a 30-second shoulder rotation in the reverse direction, just to make sure that their joints are loose and ready to go. As far as a long toss goes, there's two sides of the fence. There's guys that say let it go as far as you can throw it, and some guys who say you're going to mess up your release point if you're going to throw it on a line the entire way. I think if we look at long toss differently, where it doesn't have to be a baseball. And I think that's some of the problem. Put a football in their hand. Put a softball in their hand. Do something and challenge them. The greatest place in the world to long toss is on a football field. Most of your public municipalities now have invested $1 million or so in turf football fields that have access for you guys to use. Use it as a distance, create a challenge. Personally, I think the biggest mistake when kids go out and long toss is they get to their maximum distance, however they want to throw it, whether it's on a line or with a large arc, and they get there and then they stop and they come back in. I think the key is getting to that point and keeping them there for 6 to 8 minutes, and then working your way back in. Does that answer your question? Yeah. Right.
I agree with him 100%. If they're not sweating, they're probably not ready to throw the ball. I think a dynamic warm-up is certainly the direction most of us have gone. For us, long toss, mechanically, I think you should be sound to long toss. You can't set a distance and say, well, all our kids are going to throw 180 feet. Like even for us in spring training, we're going to give ourselves 20 minutes to do long toss. And some guys are going to take advantage of that and extend themselves to 180, maybe 210 feet. And some of us, you're going to see guys that only want to go out to 150 or maybe 120 feet. Try to use a drop step or something at 90 feet or greater for our guys. So they're not just standing there and pitching from 90 feet, which doesn't make a whole lot of sense to us. I think there should be something about how that release point happens. So that's kind of where we're at with it.
Some of the different discussions today brought up genetics. I mean, are there different tests and things that you may do at Kinetics to really determine what somebody's, maximum potential is? So, if you think if you tell that somebody, is gonna max out at 80 miles an hour on a fastball, for pure genetics.
I guess I'll comment on that with regard to things. With regard to that, from my standpoint, I do agree with what Mike was saying. It says that you gotta look at mom and dad. Look at how they were like. That'll give you a good idea. Chances are, if mom was an athlete and dad was an athlete, chances are that child's going to be an athlete. I also want to expand on the question about when a child's ready to get in the weight room. Basically, during that time of adolescence going into puberty, there's going to be a massive hormone kick right there. Testosterone is going to start to pump really, really hard at that time. So until then, don't worry about it too much. Work on flexibility. Flexibility is the key. Core is the key. All that stuff with how much you can bench, how much you can do from that standpoint, that'll come. Work on the flexibility, work on the proper mechanics, and it'll get there.
Real quick, my dad is maybe 5'10", and my mom is about 5'4", and neither of them play any sports. And they're bad athletes. I'm just going to go ahead and say that. But all three of my brothers are actually pretty good athletes, and sometimes that happens.
Also, in response to that question about genetics, I think what we do at Kinetic, and we're constantly encouraging parents, and it's been discussed here, is expose your kids to as many sports as possible. I think that's the best way you're going to find out. Maybe it's not necessarily what mom and dad did, but don't just decide you're going to be a baseball player and let's see how you do and force it. Just expose them to soccer, to football, baseball, whatever sport it is, and they'll find their niche. But the best part is you'll see what kind of athlete they are, because they may struggle on the diamond, but they're an all-star soccer player. I think that's the best way. At Kinetic, we're constantly encouraging. We talk to a lot of parents concerned about their kids, about injuries. Are we doing something wrong? And if your kid's playing baseball 12 months of the year, one of the first things I'll say is, well, you might consider exposing your 10-year-old kid to something else and just see how they do. And I think then you'll start to find the cream rises to the top, and that's where you may find, even if mom and dad were 5'10", and not athletes, maybe you do have a star in the making at a particular sport. It might just not be the sport you thought it was going to.
Well, if we find that test, I want it though, because I'm sure it'll be worth a lot of money. I would have taken 5'10", by the way.
How often should they work the core exercises, the younger ones? And also, growing up, a lot of trainers told me if you work the front side, you should work the back side. By the looks of it, you're just working the front side.
Well, with core strengthening, it can be performed every day. And the key thing is with the exercises we showed today, and there's just a lot of exercises out there that are available, but you want to mix it up. And if the exercise is functional, that's the key. Because if you think about it, same demands that some of the techniques we demonstrated today, they put demands on your son's body the same way playing baseball does every day. So we don't hesitate to let our kids, practice and play 7 days a week, but we're afraid to let them exercise 7 days a week. So make sure it's functional. If you're doing body weight things, they can do different types of core training every day. Variability is the best way to go, not the same things, because much like anything, too many repetitions of one particular action are going to put stresses through the body. And as far as front versus back, really the exercises that we showed today and the other ones that are out there, they're really hitting everything. We focused on the hips and the core the core as far as the hips and the trunk, but you'll end up getting the other exercises as you go, like the scapular stuff that's been addressed. We kind of left that off, but if you, in a screening assessment, depending on what's found, a physical therapist or the doctor or a personal trainer will certainly stress balance in the exercises that you choose.
And just remember the one slide that it's a cube, not a board. So point well taken, and if you're going to train the front and the back, certainly, which means you train it all. You can't just train one side or not the other, but don't forget the top and the bottom. So you should be breathing correctly, and we didn't touch on a whole lot of specific breathing here, but you should always be transferring air. It should never be a situation where you're holding your breath. How much air you transfer may change. Your breathing may be quick at some spots or pressed at some spots or shallow at some spots, but you'd always be transferring air. So think of the cube, not the board. You should be training kind of the whole cube, including the breathing. And the reason you can train the core every day is because the way the core muscles are, their fibers are different without getting overly technical. So they don't necessarily behave, say, like a bicep muscle. And the way you're training the core is not with a 25, 35, 45 pound dumbbell. It's repetition and function, and you're training the function. We showed you two today that we call the static dynamic K, but we could sit here for hours and give you hundreds of just functional things for every single sport, and that's really the key, is that it has to be functional.
Can't see me too well. I'm kind of one of those little guys. My son is 14 in 8th grade. He's 6'5", 240. Does his pitch count go the same as a regular 14-year-old? I know he's a freak of size. Stand up for a minute.
Yeah,
he's an 8th grade. And he is a lefty. But would his pitch count be the same as a normal 14-year-old, or how would you do that?
Wants to take a loaded question. I'll take a loaded question. So, again, this comes down to exactly what I say when I think about everybody's an individual. Not every person fits the mold of the 14-year-old. If your 14-year-old's a little older, I think you have to look at, what does he look like when he's at the end of that pitch count? Is he still strong? Are there changes in his velocity? Are there changes in his mechanics? So it's not just a number that's important, but what kind of pitchability does he have going on? Did he have, the other thing we didn't talk about in this is that The other risk factor that concerns me that didn't get into is how many pitches per inning is he making? Like when I sit in the dugout, despite what you think, if you see me on TV, is I'm looking at number of pitches per inning often on our guys, because if a guy has an inning where he throws 25 or 30, to me, that guy's at risk. So if your son has a bad inning, and throws 30 in the first inning for some reason, now to me, he's at more risk. So it's not just about pitch count, it's about what does he look like throughout the game, what kinds of things are changing, velocity, command, how easy are those innings? You know, do you have an easy 1, 2, 3 for 4 or 5 innings, and now you had a tough one? You know, there's all those things to consider. So it's not cut and dry for everybody. You know, remember the pitch counts are there as a guide, but certainly within the range of the pitch counts, you shouldn't be extending him. You know, like some of the colleges do when you look in the World Series and the guy's got 150 in a game, 160 in a game. But for the most part, I think that's going to be my answer. I think. Anybody else want to add to that?
Yeah, I completely agree with Scott about this. One thing I also want to consider with your child being at 14 is he is different than the other athletes. So from a coach's and a parent's standpoint, that does not give us the opportunity to push him any differently than the others. Because what happens over time is you push him, he thinks he's the best athlete on his team, probably is. Does he have a little bit of soreness? Is that a micro tear within that little area? Is he playing with a little bit of fatigue? Continue to watch him, and over time, is that 14-year-old, when I see him later at 17, 18, with a really sore elbow, is that an injury waiting to happen?
My question is kind of going back to the core stabilization and stuff like that. When you're talking about the static K and the dynamic K, it seemed like you did it on opposite legs. The static is on the plant leg and the dynamic is what would be on the landing leg. Would you train both legs equally, or are you specifically looking at in the static the plant and then the dynamic the land leg?
No, good question, and you train both legs equally. We demonstrated it the way we did today because naturally Bob being a righty, that would be the initial position he would assume. The static K is that initial part of the wind-up, and then the dynamic K, we just wanted it to look more like a throwing motion, so it was its opposite. But absolutely good question, and you would always train both sides. When you're talking about the core, you need balance. Okay, so you, as the question was asked earlier, front versus back, top, bottom, the core is a box, and whatever you do on the right, you want to do on the left. So both sides.
Hi, I had a question about the shoulder sag. I think it's called dyskinesis. I'm going to be coaching 9 to 12-year-olds, and I wondered if I saw that, if I noticed that, should I not have somebody who has that pitch at all? Is that going to most likely lead to an injury? Or, you know, you mentioned the risk factors. Should a child like that not pitch ever?
I don't think you can put any guarantees on anything like that. Like, a kid has this, 100%, they couldn't throw. For me, the biggest thing is when you see something like that is being aware of it, and might not be the worst idea to have them see somebody like one of the people up here so that at least they could begin to address that and show some simple exercise. If he's throwing effectively and you see it, doesn't mean you need to probably shut him down, but you certainly need to be aware of it. I wouldn't ignore it. I would have somebody else, a medical professional, that could help you with that, try to address it, because long term, if you continue to just leave it that way, then I think he is at risk.
He could throw an inning or two and be fine and not necessarily injure himself.
No, not necessarily, but again, I think the take-home point is that if you see it, and not to ignore it, and make sure that you're having somebody that would maybe try to give him some exercises to help that. Because for years, they always taught us, well, that's your normal posture because that's your dominant side. That was like in college. When I went to college, they were like, oh, that's normal. That's your posture. That's the way you're supposed to look. And then we started to get think a little bit differently about it, and then we came to the point where we don't really want to see that. We want to see it be a little more symmetrical. You're always going to see some changes on their dominant side. I don't want to paint a picture here that they're going to look symmetrical. If you throw a baseball for a living, there are going to be changes in your hips. There's going to be changes, but we just don't want them to be so dramatic that they put the kid at risk.
One other quick one. You had mentioned Cole Hamels, and we're emphasizing the fastball changeup. And I noticed, and I'm pretty sure I read this, that he had surgery over the winter.
That's correct.
Is that something that was because, is there something that you can point to as maybe the cutter that added to his stress on his elbow, or do you know? Any ideas there?
I think that's just called general wear and tear. He had some loose bodies in there, which, again, if you looked at some of the pictures that Dr. Zabat showed, you do get some of those changes. Again, everybody always goes, well, it's just loose bodies and just a clean out, but it's a sign. It's a sign for us to be aware of with him, and are there things that are going to happen to him? Did things happen to him? So it's stuff that we have to evaluate internally. We have to look at, were there changes in his shoulder, his core, and all those things. But part of it is just that if you throw a baseball for a living, you also have these kinds of things happen.
Yeah, I wanted to ask a question about one of the slides that came up there. There was a slide when Mike was speaking that said, the average youth pitcher ages 7 to 11 will be 95% mechanically efficient before a coach gets to him. So now I have two boys that pitch. I've got a 16-year-old who's very cerebral and anal and very just, he's into all those mechanics. I got a 13-year-old who is more scatterbrained and just likes to throw and all that. And once in a while, he'll just drop down and basically throw like Pedro threw, where he throws sidearm, his leg comes whipping up, and a ball just explodes out of his hand. So my question about this is, are we sometimes over-teaching kids? Are we sometimes trying to force them into like the mechanics that, the belief system or the biomechanical stuff, and sometimes not letting the kid just be who he is? I mean, Bob Gibson didn't really throw the same way Cole does, but they're both effective.
Yeah, I think the term we're looking for is you deal with two separate boys, obviously, and you just want them to be athletic. I think that's the big thing is we've lost a lot of the athleticism in pitching. I still believe that pitchers are the best athletes on the field. Right, Jesse? There's position players will argue that the sun goes down, but anyway, if your kid, if his arm finds it there, and if you want a better example, let's take both boys, bring them to some place where they can play catch, put them about 20 feet apart, and tell them to throw the ball as hard and as fast as they can at each other after they warm up, and see where their arms go.
My kids actually go to the
Yeah.
They work at All-Star up in Warrington. So
Okay. If you could have them do that, I mean, that's something that you can do at home outside. I think it's going to be 60 degrees this week again. Is take them outside, put them 20, 30 feet apart, have them throw the ball as fast as they can to each other. Just a quick hands exchange drill, and just see where their arms go. Are we teaching too much? I think so. That's why we've lost a little bit of the athleticism in pitchers. And I can tell you because I played professional baseball as well in the Texas Rangers farm system, and I'm always fascinated, and Jesse and I were talking about this a little bit earlier, look at the Latin kids. They all generically throw somewhat the same, and I'm sure you've seen more of it. They all throw with a mid to low three-quarter slot. Very rarely do they have problems, and they're not picture perfect mechanically for what we think, in the United States, and they just pitch athletically. Whatever they want to do, if he's better off from a mid three-quarter slot, let him throw that way. If we try to change that, I think that's the problem is. I've always found when we try to change a kid's natural arm slot is when they have a tendency to break. Usually they break in connective tissue somewhere. Then you got to go see one of these guys. Can I answer your question?
Is that kind of the affiliate approach too, or do they have a take on what's the most efficient? I mean, there's a certain measure of efficiency too. At least that's what you're sold on.
For the most part, Jesse can answer this better than I can, but we don't usually mess with mechanics a whole lot the first couple of years kids are in our organizations. You kind of want to let that play out. And, there's a reason that you drafted them, is because they pitched effectively, and so very little goes into addressing a whole lot with their mechanics the first couple of years. Is that correct? Yeah, true statement. For once I got it right. Not a pitching coach, but that's kind of our philosophy, I think, is that You know, if it ain't broke, don't fix it initially. And that doesn't mean that as an athletic training staff, we're not doing things to try to make them stronger and a better core and set them up for success that way. But, you know, effective mechanics are effective mechanics. Look at golf. Jim Furyk, golf swing looks absolutely goofy, but a lot of tournaments and a lot of money. So,
I have a couple questions. One for the panel. Growth plates. We talked about growth plates tonight. How fragile are they in the sense where we talked about pitching, but other things like hitting, running for young boys and girls, and when do they actually stop, you know, where they're kind of stop growing? And the other thing is, if a pitcher pitches for 4 innings, if we have them on the mound, will we be doing more harm if we put that player on third base or the outfield to try to throw differently? You know, you're throwing a different type of ball from third base as you were as a pitcher or even out in the outfield.
Regarding the growth plate question, we have growth plates on our entire body. Growth plates in the elbow, shoulder, knees and ankles, and they're all are prone to injury. At various points in their adolescence, those growth plates will eventually fuse. To be more sure that everything is fused, that's when that adolescent puberty kicks in. So that's when we'll know that they're fused. But until then, all these locations are prone to injury. As I said in my first slide, 50% of our athletes are getting hurt because of overuse. That's a big number. That's something that everybody in this room can work on. They kind of do things in a nice, balanced way to keep our athletes nice and safe. I'll have the rest of the panel answer the other question.
I'll answer your question about putting them back in the field. There's too much emphasis on winning and not developing. And to answer your question over here, Dad, you just got to learn how to say no with your son. That's it. You know, if we have to put a kid back in because he's one of the better players on the team and we want to try to win the game, does it really matter in the grand scheme of things? You know, you can do that kid much better just to sit him down, pat him on the butt, say, hey, good job. You know, and really all they want to do, what age group are we talking about? 11-year-olds. They just want to go to the snack bar and get a slushie at the end of the game. That's really all they care about, right?
ditto for that. Agree 100%. You know, if I had my, and I know that if our kids are in the same league, that there are enough kids on the team to fill the field. If we can take that kid out and protect him after throwing, I'm all for it.
So for the core, like, the exercises, would you suggest like a different amount of sets and reps like per side as far as, like throwing is, an unbalanced act. So would you do unbalanced training to kind of counteract that, I guess, is what I'm asking.
No, you'd still keep it, again, you want to focus on being very balanced in how you perform it, equal on both sides. And the thing you want to remember is, like I said, it's about perfect practice, not just practice. As far as repetitions go, this is why it's best to have a partner. You do it until you can't do it correctly. In the beginning, if you're Bob and that's 5 reps, then that's what it is. Sorry, Bob. But if that's what it is, and then you work on that, and you want to continue to improve on that, because it goes back to something Darren said earlier about weight training. It makes no difference. If you're going to do it, you're going to do it incorrectly. What are you trying to do? Are you doing it so you can say you did it? We want to talk about doing these repetitions perfectly. Just like when you work on your mechanics, it's not just about throwing, you're trying to fine-tune your mechanics. So you want to perform equal and opposite both sides. As far as number of repetitions, that's going to be dictated by how well you perform that exercise. Maybe in the beginning it's 3 sets of 5, because after that you fatigue, and as you fail, the exercise fails, and then you build your way up.
Remember about a pitch, it's very balanced. I can understand why it looks unbalanced, but it's not. It's asymmetrical, but very balanced. And that's the key to remember. Asymmetry is not balanced. But certainly it looks that way because, right-handed throw, left-handed throw. But if you think about it in terms of asymmetry, not unbalanced, not only can you prevent injury, but then you can enhance performance. And that's why you really want to do both things every leg, both legs, both sides, because you need to balance yourself out. The more balanced you are, the more you address the cube, not the board, and the more your performance. As Mike talked about a little bit earlier, it's, if you look at those, it's always opposite and equal. It's just asymmetrical, but still very balanced. And that's an important concept to remember.
Sorry, I guess what I'm wondering is like if you get your dynamic K that perfect to mimic your throwing really on the mound, then wouldn't you be getting in more reps on the mound of essentially another dynamic K on your dominant side? Wouldn't you have to get in extras on your non-dominant side for exact symmetry, I guess?
Yeah. Let me answer it this way. I don't know if this is exactly speaking to your question, but something Matt alluded to earlier. It's you want to do this, like, so say you can achieve 6 repetitions with it looking good, then that's it. 7, if you do 7, 8, 9 bad, you're only reinforcing a bad pattern. So you want to do it over and over and over again, and then at some point, certainly if you want to give me a call for free, certainly, or email, whatever, I can certainly give you like a protocol, more, a little bit beyond the scope of discussion here, but a protocol in terms of how long you do it or how long it takes to do this or what you're trying to accomplish. But you want to be able to do this over and over again, and infinitum, 100 reps, because like you said, you're going to try to throw 60, 70, 80 pitches. So you should be really good at this dynamic K over and over again, because that could be the difference between you being a 5-inning guy or a 6-inning guy or a 7-inning guy. And I hope that speaks to your question.
Let's see, if you want to get into specifics of how hard I was throwing, I was probably 83, 85 freshman year, 85, 86 sophomore year. But I just, I got older, I got stronger. I found a coach that I really liked, that I felt comfortable with, that was actually, when I first went to see him, he videotaped me, put me on the screen, and just basically laughed at me when I was a freshman. He said, "This is pretty bad. I'm just going to be honest with you, it doesn't look good, but these are the things we need to do to fix it." So I got older, I found a coach that I really liked, and everything just started to click, and you got to have faith in that. If you put in all the work, your body's going to perform the way that it should.
Mike, probably for you. Pitch count. I know like 60 is a number or whatever, and I know it depends on the kid and everything. But you got pregame warm-up and you got the pitches between innings. How much should they count towards that 60 count, if that's the count you're going with?
Well, if you do your pregame warm-up, hopefully the majority of it's on flat ground. And I just want to emphasize to you guys the importance of flat ground. When I say impact pitches, or an impact pitch is a game situation. The body reacts different, probably physically, chemically, when you have a batter and an umpire and a catcher, and you're ready, and you're competing. The amount of force that's applied to the body, I imagine, is a lot different than you are just warming up. I don't ever remember anybody really getting injured in a bullpen or in a flat ground session.
What would that include between innings?
Between inning pitches, there's not a lot of effort involved in those. Depending on the kid, I always found them to be a waste of time personally. I was always just, give me the ball, I'm ready to go. But that depends on how you're built and how you're wired. But I would just count in-game competitive pitches, batter on pitcher, as from a pitch count perspective.
Whatever it takes for warm-up.
And whatever it takes for a warm-up. And everybody's different. You can't cookie cut it. Some kids can, I was a reliever in professional baseball, and I was born with a rubber arm. I could throw 2 balls in here and be ready to go. And not everybody's like that. Some guys it takes them a little bit longer to get loose.
This is for Jesse. Jesse, I'm sure you have the talent and all that, but I'd like to talk about work ethic. A lot of times you hear players are good, they go on, and the coaches always say, here's the hardest working guy I knew. All the work you put in is paying off. Could you talk about your work ethic and kind of what separated you from other players coming up?
Yeah, I guess, I worked a little bit harder than some of the guys I played with. But, that's just that's what happens. You figure out, like when I was, in 2008 when the Phillies won the World Series, I was at the game and I saw Cole Hamels pitch. And that changed my life. I saw him pitch in the rain, in the driving rainstorm. It was freezing, and I watched every single pitch with amazement because he was pitching incredibly well in the worst situation ever. It was terrible weather. Like, I'd never seen a game like that before. And to me, that was such a big moment in my life because I saw that and I really wanted to do that. And I wanted to, put everything I had towards that goal. Now, I'm not saying that there's going to be crystallizing moments like that for everybody, but in this situation, that's what really was driving me. So, I guess that my work ethic was a big part of it. I'm also, left-handed, which is nice, and I guess there's some skill involved too. But there are a lot of guys who work hard, and I really believe that is the biggest thing, and that is the one thing that I think is so important, because when you work hard in anything in life, good things will happen to you. I really believe that, and that's what I really want to tell kids. That's it.
Coaching lightly, the reputation's already around. He's got a great work ethic, so don't let him downplay his work ethic. All the reports on our side are that this guy works hard. So if that's what you're looking to hear, I would agree that that's a big part of what you see. I mean, if you look at the people that make it to our level, there's a reason, and the reason is usually because they've had some plan every day they walk in to either the park or the workout facility. I think that's always one of our goals, is to get guys, even at the younger levels, come into the place, have a plan every day that you walk in there, have a purpose behind. Every time you pick up a ball, have a purpose. And if you do that, then you got a better chance of giving yourself a chance to succeed.
Any more questions? All these great professionals here, I know I'm speaking for them when I say they're here for you as well, even on an informal kind of basis. There is a screen that I have in the back of your manuals. I've done some here at All-Star. We're willing to, what they say, they're talking about getting a screen. Where do I get the screen? I got a screen. So if you need a screen, give us a call. I want to be that community professional that can identify some of these things and give you some framework for what you can be working on. I take this opportunity to thank everybody on our panel: Drs. Darren Rodia, Matt Schildneck, Scott Sheridan, Eric Zabat, Jesse Biddle, and Mike Manning. Thank you guys so much for coming out. We will definitely see you next year, and hopefully here.
How you doing? This is Jesse Biddle, coming from the Pitching Survival Guide. Great program, learned a lot, really good for youth kids to learn, and there's a lot of helpful information that you can get from this.
No problem, no problem.
My name's Scott Sheridan. I'm the head athletic trainer for the Philadelphia Phillies, and we're here at Kinetic Rehab's Pitching Survival Guide. This is our 4th year of doing it. It's a great opportunity for us to educate the community about concerns for injuries in youth sports, not only baseball but all sports. A chance to meet with parents, coaches. Like I said, it's a good opportunity for them to ask us questions and concerns that they have for their kids, and try to get them in the right direction, try to get them into kinetic rehab or get them into some of the physicians that presented here for their concerns.